hospital located in the 2nd District, and of course, our hospital in the 4th and 5th District. Capacitating our hospital to provide tertiary care can certainly decongest the Western Visayas Medical Center, which is already at full capacity all of the time. Providing tertiary specialty care at our hospital will lessen the load of WBMC, hence a more equitable distribution of resources or beds for Iloilo Province. Thirdly, since the COVID pandemic started, we were frequently bothered by the thought on how we can contribute more to our government's response to being a DOH-retained hospital. We can only spare 21 beds for COVID-19 patients, even though we wanted to have more. However, we can turn our backs to our other patients who are equally needed or are needing our services. More so, we experience challenges in following infection control protocols and patient segregation because of our limited number of hospital beds. Added to this is the limited number of personnel already mentioned by our good congressman. We have a long list of reasons why Don Jose Montfort Hospital should be given the privilege to expand its mandate and service capability and become a significant contributor to the delivery of healthcare services in our part of the country. But given the time constraint, let me end by sharing with you one of my favorite sources of inspiration, Mr. Joel Barker, and I quote, "Vision without action is merely a dream. Action without vision just passes the time. Vision with action can change the world." Ladies and gentlemen of this august body, please help us act on our vision so that we can change the world. Thank you very much, and let us have a pleasant and productive day. Thank you very much, Madam Chair.
Thank you, Dr. Hembra. May we hear from Mr. Rod Napulan from the Division Chief of Health Facilities Development Bureau.
Thank you, Madam Chair. Good morning, everyone, and the rest of the members of this committee, of the Committee on Health, as well as our officials from the Department of Health and my colleagues in the government service. Madam Chair, let me read the signed position paper of the Department of Health, which we already submitted to the committee. So, position paper on the House Bill number 6536, an act expanding the mandate and service capability of the Don Jose S. Montfort Medical Center, Extension Hospital in the municipality of Barotac, Nuevo, Iloilo, renaming the same as the Don Jose S. Montfort Medical Center and appropriating funds therefore. House Bill number 6536 seeks to increase the bed capacity of the Don Jose S. Montfort Medical Center Extension Hospital in the Barotac, Nuevo, Iloilo from 100 to 300 beds and expand the commensurate service capability. It also seeks the renaming of the hospital into Don Jose S. Montfort Medical Center. As mentioned by Dr. Hembra a while ago, Don Jose S. Montfort Medical Center Extension Hospital is a level 1 DOH General Hospital with a 100-bed authorized capacity. Hospital statistics in 2019 showed that its bed occupancy rate was 115%, which is beyond the national standard of 80% to 85%. During that year, the number of inpatients and outpatient visits increased by 28% and 24% respectively. It also serves as the referral hospital in the neighboring districts and municipalities of the Barotac, Nuevo. Based on 2021 to 2025 Hospital Development Plan of the hospital, it directed to have improved diagnostic capability and departmentalized services for medicine, OBGYN, pediatrics, surgery, orthopedics, dental, and anesthesia departments. As such, expanding its capability as well as service capacity is necessary to improve the health services, access and delivery in the whole of Iloilo Province and nearby provinces of Iloilo. Based on the above mentioned, the Department of Health interposes no objections and fully support to expand the capacity and renaming of the hospital. However, Madam Chair, may we also recommend the following: capacity expansion and commensurate upgrades to the facilities and professional health services shall be in accordance with the Hospital Development Plan approved by the DOH. And also, to repeal Republic Act number 8372 or an act converting Don Jose S. Monfort Memorial Hospital in the municipality of Borotac, Nuevo Iloilo into a tertiary hospital functioning as an extension of Western Visayas Medical Center in Iloilo City to be known as the Jose S. Monfort Medical Center Extension Hospital and appropriating funds therefore. With the recommendations above, Madam Chair, and the proposed measure shall aid in strengthening the hospital's healthcare provider network as intended in the implementation of the UHC and as aligned with the Philippine Health Facility Development Plan. Respectfully submitted, Madam Chair.
Thank you, Sir Rod. Considering that the DOH interposes no objection, may we hear a motion for the approval of House Bill 6536.
Madam Chair,
Songging.
may I move for the approval of the said bill? So move, Madam Chair.
Seconded, Madam Chair.
I second the motion as well, Madam Chair.
There's a motion to approve House Bill 6536, duly seconded. Is there any objection? Hearing none, the motion is approved. Before we proceed on the second bill, may I recognize the presence of the following: Representative Mickey Biolago, Representative Sabelliano, and Representative John Ray Chanco. Okay, let's now proceed on House Bill number 49, entitled An Act Establishing Veterans Memorial Medical Centers in Luzon, Visayas, and Mindanao, authored by Representative Manuel Cabochan III. May we hear from Representative Cabochan?
Thank you, Madam Chair. May I proceed?
Go ahead, sir.
Thank you very much. Madam Chair, esteemed colleagues, resource persons and guests here today, good morning. I would like to sponsor House Bill number 49. Article 16, Section 7 of the 1987 Constitution expressly declares that the state shall provide immediate and adequate care, benefits, and other forms of assistance to our veterans, with majority of them being elderly and sick. Policies for our veterans should focus on supporting their healthcare needs. Veterans Memorial Medical Center was established exactly for this purpose. Through the years, various legislative amendments were introduced, including Republic Act 6948, which expanded the definition of veterans and included the retirees of the armed forces of the Philippines as well. Likewise, the hospitalization benefits were extended to the dependents of retired military personnel. With this, the VMMC have to cater to a larger constituency. Furthermore, many of our retired soldiers and veterans are facing difficulties in traveling to Quezon City to receive consultation, monthly checkups, and treatment at the Veterans Memorial Medical Center. The distance and the cost of travel become a struggle for most veterans, especially for those who live in the northern and southernmost part of the country. Thus, there is a need to increase the accessibility of healthcare services for the veterans. This is the aim of House Bill number 49, which proposes to establish additional Veterans Memorial Medical Centers in the three major islands, Luzon, Visayas, and Mindanao. On the other hand, the Magdalo Party List also recognizes the efforts of the Philippine Veterans Affairs Office and the Department of Health to address the issue of accessibility by accrediting hospitals which could cater also to veterans. This representation leaves it to the wisdom of this committee as we go on with the deliberations to determine which be the best arrangement, whether establishment of additional VMMCs accreditation of hospitals, or assignment of veterans wards. Ultimately, our goal is to have an institutionalized policy that would help our veterans have access to quality health care. Wherever they may be in the Philippines, our veterans should be able to maximize the services that are meant to them. This is our way of showing support and gratitude to the valiant who have defended our country. It is also our way to show the next generation of how we value our veterans, so they would be encouraged as well to heed the call of service. Thank you, Madam Chair.
Thank you, Kong. Do we have representative from DND?
Madam Chair, yeah. I represent the Secretary of National Defense. I'm
Okay.
Under Secretary Carolina.
Mr. Ernesto Carolina from Philippine Veterans Affairs Office. Go ahead, sir.
Thank you, Madam Chair. Magandang umaga po to one and all. First of all, on behalf of our veterans, we'd like to thank the sponsor, Honorable Magdalo Representative Manuel Cabuchan III, and also the Committee on Health of the House for taking up this very important bill. Madam Chair, we have forwarded our position on behalf of the veterans, strongly supporting the bill sponsored by Representative Cabuchan. Very correctly, Madam Chair, we have only one veterans hospital, and that is the one in Quezon City, catering to all our veterans. Our veterans are all over the country. We have veterans up to Tawi-Tawi and Sulu, in all parts of Mindanao, the Visayas, and in far northern Luzon. And even those in Luzon, if you are from Cagayan, Apari, apakahirap pong pumunta sa Veterans Hospital. We have been, our veterans have been articulating in the past, in the previous Congress, Madam Chair, a bill was filed, the House Bill 1141, also exactly seeking to establish additional Veterans Hospital. At least one in Northern Luzon, and then one in the Visayas, and one in Mindanao. We have a growing number of veterans, Madam Chair, kasi those who retire in the armed forces, they are veterans of military campaigns, Kamplong campaign, anti-insurgency campaign, secessionist campaign, and up to this time, we have soldiers that are killed in action. All of this constitute what we call, Madam Chair, the Filipino veterans community. It's a very large community. They are silent and they are unnoticed. But as Representative Cabuchan said, one of the purposes of the bill is to show the citizenry that we are a nation that does not forget her defenders. Now we take care of our veterans. And that is not being projected right now, because we have only one veterans hospital, a very important, a basic requirement to take care of veterans. Just to highlight, Madam Chair, the disparity. Taiwan, which is a very small country, they have 8 veterans hospitals. Of course, the United States, they have more than 200 veterans hospitals. Thailand has 20 plus veterans hospitals, but I don't know what happened. We have only one veterans hospital built before 1960. And through the graces of the United States. Hindi pa ho tayo ang nagpatayo nun. So I think it's high time that we answer the call, the long time clamor of our veterans. Lalo na po ngayon na marami na sa kanila matatanda na, they are very vulnerable, nagkaroon pa po ng COVID. And Madam Chair, and with the permission of the sponsor, our request is if we can expand the number of bed capacity. Kasi po ang minimum tertiary hospital should have a bed capacity of at least 250 po. So we would like to request that as a reaffirmation of House Bill 1141 filed in the previous Congress, that bill recommended a 250-bed capacity hospital so that it can viably respond to the large number of veterans that we have in the Visayas, in Mindanao, especially in Luzon. Yung pong nag-iisang hospital natin sa Quezon City, Madam Chair, takes care only of 30%. Yung mga nandito sa National Capital Region area and adjacent, yung malalapit na probinsya like Batangas, Cavite, Laguna. All others po, hindi na ho nakakapagpa-hospital. Kasi wala po. Yung pong sinasabing accredited hospital, if I may expound, it is not working kasi accreditation lang po yun eh. We accredit a good hospital, halimbawa, Soto Hospital in Cebu. But the chairperson, of course, would know that these hospitals, kulang pa ho yung kanilang facilities for the local populace. Kaya yung veterano po, talagang hindi na po nila ma-accommodate. Plus, the law provides free medication para sa ating mga veterano. Kaya ang attitude ng accredited hospital, tiway yan. Baka hindi tayo, in other words, parang iwas pusoy. They tend to not to be very accommodating. Nararamdaman po yun na ating mga veterano, especially yung World War II veterans. And really, they feel bad, pero nakikita po yun ng mga tao na ganyan pala yung nangyayari doon sa mga nagdepensa ng bayan natin. Nakikita po nila marami pong mga veterano sa probinsya ay namamatay, hindi po na nakakapunta ng ospital. Hindi naman po namin na-monitor kasi po malayo po sila. So, Madam Chair, we strongly recommend that the committee supports the approval of this bill. Salamat po.
Thank you. Thank you, sir. May I recognize representative from DILG kasi DILG was mentioned in the bill, Yusek Echeverry. I think we have Yusek here.
Yes, Madam Chair.
You want to comment on the bill?
Yes, thank you very much, Madam Chair. As for the DILG interposes no objection to the bills and would refer the matter on specific matters to the Department of Health. We actually support the said proposal and looking forward of for the TWG. Thank you, Mr. Chair.
Thank you, Yusek Echeverry. Sir Rod, from the DOH, are you ready to comment on this bill? Although DOH was not mentioned in the bill.
Yeah, thank you, Madam Chair. And let me read, Madam Chair, the draft position paper. This is still on routing for the signature of the Secretary of Health. Once it is signed, we will submit immediately, Madam Chair. But meantime, Madam Chair, let me read, Madam Chair, the draft position paper of the Department of Health. So this is on the position paper of the House Bill number 49, an act establishing Veterans Memorial Medical Centers in Luzon, Visayas, and Mindanao as introduced by our Honorable Representative Manuel D.G. Cabochan III. So the Department of Health acknowledges the good intention of the proposed measure that aims to ensure the delivery of adequate health care for Filipino veterans and their dependents in line with the Constitution. However, Madam Chair, we have the Department of Health has some reservations on the proposal to establish a Veterans Memorial Medical Center in Luzon, Visayas, and Mindanao under PVAW. This is in view of the existing agreement between the DOH and PVAW on the establishment of veterans wards in selected DOH hospitals nationwide. These selected hospitals will be equipped and capacitated to provide appropriately their quality care for the veterans. Under Republic Act number 6948, veterans and their dependents may be admitted free of charge into any government hospital pursuant to arrangements between the PVAW and the DOH. In line with this, the DOH and the PVAW, through the Department of National Defense, signed a Memorandum of Agreement on the Veterans Hospitalization Program in August 2014. Further, the DOH issued Department Memorandum Number 2018-0437 for the Veterans Hospitalization and Medical Care Program, enjoining all hospital chiefs, medical centers, and sanitaria to join the program. Currently, the Southern Philippines Medical Center and the Northern Mindanao Medical Center, both located in Mindanao, Level 3 DOH hospitals, are the pilot hospitals for the establishment of veterans wards. The SPMC in Davao City, the Northern Mindanao Medical Center in Cagayan de Oro, and PVAW entered into a Memorandum of Agreement for the construction, renovation, and other structure outlays of the establishment of a 15-bed veterans ward. Moreover, the DOH and the DND have finalized a joint administrative order to expand the implementation of the establishment of veterans wards in other DOH hospitals nationwide. Based on the foregoing, the DOH recommends to fully implement the establishment of veterans wards in selected DOH hospitals instead of establishing a new Veterans Memorial Medical Centers for each in Luzon, Visayas, and Mindanao. Respectfully submitted, Madam Chair.
Thank you, Rod. I'd like to recognize first the presence of our representative from PLLO, Yusek Jacinto Paras. I think Kongging Swansing would like to ask question. Kongging?
Thank you, Madam Chair. I would like to commend our colleague for coming up with this bill. I fully support. But Madam Chair, allow me to ask some questions to the author and to the representative of PVAO, si Sir Ernesto. Ano po bang services ninyo na wala po sa ibang government hospitals?
Madam Chair, can I answer the question?
Sure. Go ahead.
Yeah, Madam Chair, the lone veterans hospital that we have, the Veterans Memorial Medical Center, is a geriatric hospital. In other words, it specializes on illnesses of older people. So largely, they have a hemodialysis, yung dialysis for the kidney. They have a prostate cancer center. They have a cardiac center. So practically all the services available in a medical center. That is why the proposed additional veterans hospital in Mindanao, for example, we are proposing it to be upgraded to 250 bed capacity because that is the minimum required number of beds in a tertiary hospital. Yung pong accredited na, yung sinabi kanina na accredited hospital, with the DOH, we signed a memorandum of agreement.
Sir, sir, in the interest of time, so
yes, yes,
lang po, ano pong services meron kayo na wala po dun sa ibang government hospital? So sinagot nyo na po,
okay.
pareho lang sa other government hospitals. Tama po ba?
Hindi po. Yung Veterans Medical Center po, kumpleto talaga po yun. For example, sa dialysis, they are at par with the National Kidney Center. Yung usual,
so,
ang mga government hospital po natin sa probinsya, usually po, yung confidence ng veterano natin medyo mababa dahil parang marami silang kulang na services.
Okay. So, ibig po sabihin, yun pong services ninyo, no, like for example sa kidney is also available in Kidney Institute, tama po ba?
Opo, yeah.
Okay. So wala po kayong services na hindi available sa other government hospitals?
Marami po kaming services na hindi available sa...
Ayun po ang gusto kong malaman. Ano po yun?
Yes,
ang anong services meron kayo na hindi available sa government hospitals?
Karamihan po ng para sa matatanda, halimbawa po yung pinag-uusapan nating hemodialysis, available nga po yun sa National Kidney Center, pero yung National Kidney Center nasa Quezon City din. Ang pinag-uusapan po kasi natin yung sa Mindanao at saka sa Visayas, marami po tayo. Yun po, ang mga government hospital po doon, mababa ang capacity.
Oo, capacity po, capacity, pero hindi po services. Ibig sabihin, ang medical services in terms of pertaining to kidney, available din naman po sa government hospital. So clear po yan, kasi pina-follow through ko lang po yung position ng DOH na kaya po they don't agree is because available naman yung services na ino-offer ng veterans dun sa other government hospitals. Ilan po kaya, ang tanong ko po, ang intention po kasi ng Veterans Hospital is to service yung veterans natin,
Yes, ma'am. Yes, ma'am.
Okay, wala po bang hindi veterans na naka-admit sa hospital ninyo or nagpapa-check up?
Meron po, the law allows BMMC to accept at least 10% of their total patient. Yeah.
So may requirement po ba yan na anak po ng veterano o related sa veterano?
Yes, ma'am. To qualify for free medication, dapat veterano siya or eligible beneficiary like asawa, the legal spouse, and children, minor children less than 18 years old are qualified dependents, Madam Chair.
If I may add lang, Kongging, I think the difference is in VMMC, free sila, free ang service. I think all expense paid compared to when they bring the patient to a DOH retained hospital. Correct me if I'm wrong, Rod. Hindi siya all expense paid. So in the VMMC, free talaga yung veteran and a family. Wala silang out of pocket.
Actually, ma'am, even in DOH hospitals, they could also be free based on the BHMPP program of the PVAU, Madam Chair. As well as since we also have PhilHealth, Madam Chair, if may need pa po for additional services, complement pa rin po ng ating no balance billing policy kasi mga senior citizens usually din po sila.
Yeah, but the senior citizen na pensioner is not qualified in the NBB, if I want to remind you. Yun yung difference Hindi kumpara doon sa VMMC, talagang ang veteran ay all expense paid. Siguro isa sa reason. And I think kay Mr. Ernesto Carolina, if I remember it correctly, former President Arroyo filed a bill on the modernization of the existing VMMC. So kanina kasi na-mention nyo, hindi at par yung dialysis like what we have in NKTI doon sa facilities ng VMMC. Baka the author would want to consider an upgrading or modernization of VMMC and expansion of services to veterans in partnership with DOH retained hospital to make it feasible. Go ahead,
yes,
you have a follow-up question.
Yeah, Madam Chair, I think because lahat tayo meron tayong mga kamag-anak na veterano, we heard about kung ano yung kulang dun sa VMMC, I propose that instead of opening or establishment or conversion to other places, let us focus first on how we can help the Veterans Memorial Medical Center. So sana po ay makonsider natin yon, Madam Chair. Thank you very much.
Thank you, Kongging. I'd like to recognize Representative Bolilia. I think she wants to ask questions.
Okay. Yes, Madam Chair.
Yes, may problema yung audio.
Okay, go ahead, Kong Bolilia. Kong Lianda. Okay, I'd like to recognize the sponsor, Kong Kabuchan.
Thank you, ma'am.
Yeah. Would you like to consider the recommendation, or would you want to have a technical working group for the refinement of this bill?
No, yes, ma'am. I am amenable to the recommendation as to modernize and keep VMMC at par with the other hospitals. And Madam Chair, I'd like to request, and I will wait for the position paper to be signed by the DOH, so that once and for all, we would be able to really see that the veterans hospitalization and healthcare programs outside NCR or in other parts of the country will be institutionalized. Kasi po, ang problema dito is yung accessibility sa VMMC sa Quezon City. So, kailangan ho ng mga veterans natin na nasa probinsya yung access po dun sa healthcare sa provinces nila. So, ang sabi ho kasi ng ng DOH is for sticker pa ho yung kanilang position paper. But I am amenable po to modernize the VMMC. Thank you very much, Madam Chair.
Thank you, Kong Kabuchan, kasi we haven't received an official position paper from the DND. Kong Ging, maybe you want to move for a creation of TWG?
Madam Chair?
Andiyan na si Lianda, Madam Chair.
Kong Lianda.
I make a motion.
Yeah. Madam Chair?
Yes,
Madam
go
Chair?
ahead, Kong Lianda.
Okay, Madam Chair, I support the intention of the bill, but of course, any establishment of additional hospital, we know would require a corresponding peso amount to implement it. So I'd like to know from the proponent or from the DOH of if they have any idea of how much will it cost to establish one veterans hospital.
Sir Rod, do you have an idea? Although the veteran hospital is not under the DOH, it should be run by the DND. Rod, at least an idea of establishing a military hospital.
Yeah, I think it is very important that we know how much will this cost the government.
Madam Chair, if may answer. Madam Chair, it depends on the service capability as well as the bed capacity of the proposed hospital, Madam Chair.
But the minimum, let's say 50 bed capacity.
200.
It
You are
requires
proposing
a half billion, Madam Chair.
Yeah, I agree.
Yeah.
so that means that if we are building the one hospital per how do you call this, in Luzon, Visayas, Mindanao, one for it. So we're establishing three. That will cost us about 1.5 billion. Oh, is that correct?
Yeah, for level 2, Madam Chair, for a city, the equipment is around 40 million, and the infrastructure is around 160 million. But we need also to consider the operating expenses of the hospital, which is recurring every year for both the personal services as well as the MOE, which also requires around 130 million, Madam Chair. So all in all, the total expense for establishment is 200 million for both equipment and infrastructure, and then a recurring budget requirement for operations of 130 million, Madam Chair.
So the
That's
total of
only-
which is?
It's around
The total amount of which is?
It's around 400 million, Madam Chair.
400 million for each.
Yeah, and the recurring amount is necessary for the operations around 200 million, Madam Chair.
Okay, if
600.
suppose we are to pass this bill, you think that we can have this funded?
May we ask Pevao, Mr. Ernesto,
Yes,
that the DND has enough fund for the establishment of 3 additional VMMC?
Thank you, Madam Chair. It's going to be appropriated. As I said earlier, a bill was filed already in the last Congress, 11441, and the cost of one veterans hospital was part of the submitted budget, Madam Chair. So this is not going to be one time to be implemented 1 year. For example, if the program will be in the next 5 years, Madam Chair, ang importante alam ng veterano natin na yung gobyerno nagplano na ng hospital para sa kanila at sa Mindanao muna kasi may lupa na doon Madam Chair. I just would like to manifest, Madam Chair, kulang kasi yung sinasabi ng DOH. Meron nga kaming MOA, Band-Aid lang po yun. Para lang may mapupunta na yung veterano ngayon. Maliliit lang po yun yung Veterans Ward. Kailangan pa rin po talaga na at least may Veterans Hospital tayo sa isang island. Mindanao, napakalaki po nun. It is necessary and symbolic po para alam ng mga veterano natin.
Okay, thank you, sir. Siguro we can further discuss yung mga details and technicalities of this bill when we created a TWG.
Yes, Madam Chair.
Yes.
Can I make a motion?
Comranda, are you done with your query?
Yes, Madam Chair.
Thank
We'll
you,
just
Comranda.
explore some more questions during the TWG meeting if this is going to be created.
Thank you. Konggi?
Madam Chair.
Yes, Madam Chair, may I move that for the creation of a technical working group to improve and discuss on House Bill number 49. So move, Madam Chair.
Second.
There's a motion to
Second.
create a technical
Motion, Madam
working
Chair.
group on House Bill 49. Duly second.
That I'm ordering from my
The motion is approved. Would like to
If
proceed
I buy
on House Bill
in
number
bulk,
426,
300 pieces, but I
offered
don't
by
like my
Representative Rufus Rodriguez, entitled An Act Establishing a 50-bed District Satellite Hospital of the Northern Mindanao Medical Center in Barangay Tablon in the 2nd District of Cagayan de Oro, to be known as the Barangay Tablon Northern Mindanao Medical Center District Satellite Hospital, and appropriating funds therefore. Representative Rufus Rodriguez. Do you have Kong Rufus? Okay, if he's not around, is there anyone from the committee who wants to sponsor this bill?
Madam Chair.
Kongging.
I would like to manifest that the explanatory note will serve as a sponsorship speech of Congressman Rufus Rodriguez on House Bill number 426. So move. Thank you, Madam Chair.
Thank you, Kongging Sonsing, for sponsoring his bill, House Bill 426. May we hear from DOH Region 10, ARD Elenieta Gamolo. If she's not here, may we hear from Mr. Rod Napulan.
Good morning, Madam Chair.
Go ahead, ARD.
Yes, good morning, Madam Chair. In behalf of our Regional Director, we are going to read the position paper of DOH, CHDNM on House Bill number 426. This is to formally acknowledge the receipt of the copy of House Bill 462, 426, an act establishing a 50-bed district satellite hospital of the Northern Mindanao Medical Center in Barangay Tablon, the 2nd District of Cagayan de Oro City, to be known as Barangay Tablon Northern Mindanao Medical Center District Satellite Hospital, and appropriating funds, therefore, being authored by Representative Rufus B. Rodriguez. The Center for Health Development, Northern Mindanao, interposes no objection to establish such 50-bed NMMC satellite hospital in Barangay Tablon, provided that the said facility will cater all patients of Cagayan de Oro City and nearby municipalities as well. These recommendations shall complement the Universal Health Care Act implementation aligned with the Philippine Health Facility Development Plan. That is all, Madam Chair.
Thank you, ARD Gamolo. May we hear from Mr. Rod Napulan?
Thank you, Madam Chair. Let me read, Madam Chair, the draft position paper and signed position paper of the Department of Health, incorporating the position papers of the stakeholders submitted to the central office. So this is on the House Bill number 426, an act establishing a 50-bed district satellite hospital, the Northern Mindanao Medical Center in Barangay Tablon in the 2nd District of Cagayan de Oro City, to be known as the Barangay Tablon Northern Mindanao Medical Center District Satellite Hospital, and appropriating funds, therefore, as authored by Representative Rufus Rodriguez. The DOH acknowledges the intent and supports the establishment of a hospital in the Barangay Tablon, Cagayan de Oro City, as this would make health services more accessible in its catchment area. As such, the DOH acknowledges the good intention of the proposed measure that seeks to establish a 50-bed Barangay Tablon, Northern Mindanao Medical Center District Satellite Hospital in CDO. Residents of Barangay Tablon and nearby barangays need at least 2-hour travel to access the nearest hospital, which is the Northern Mindanao Medical Center. The city government of Cagayan de Oro City has included in their local investment plan for health the construction of a 25-bed infirmary health facility in the same barangay, and is currently under construction. Given this, it is more strategic to collaborate with the city government than to establish the Northern Mindanao Medical Center District Satellite Hospital. Further, completing the manpower for the proposed hospital to function as District Satellite Hospital of the Northern Mindanao Medical Center is a major concern. Also, if it intends to minimize referrals to the Northern Mindanao Medical Center, then it must be capable of providing services higher than an infirmary. Based on the foregoing, the DOH recommends that instead of an extension hospital of the NMMC, establish a separate hospital with a service capability higher than infirmary that shall be under the direct supervision and control of the local government unit. This will mandate the proposed hospital to have its own PS or personnel services, MOE or the maintenance and other operating expenses, and the capital outlay to avoid stretching the resources of the NMMC. In line with the Philippine Health Facility Development Plan, the DOH is willing to provide capital outlay support for the proposed hospital should it be included in the General Appropriations Act. Respectfully submitted, Madam Chair.
Thank you, Sir Rod. Do we have Representative Rufus Rodriguez? Because the recommendation of the DOH is different from the proposal of the sponsor, and we want to hear if the author is amenable to the proposal. I'd like to hold the approval of this bill. Okay, would like to
Madam Chair.
Kongging.
Can we ask Representative Sariaco to make a motion kasi ako yung nag-sponsor eh.
To defer the proposal.
To defer the proposal po.
Madam Chair,
Go ahead, sir.
Madam Chair,
Please proceed, sir.
considering that the position of the Department of Health is significantly different, if I may say so, from the proposed bill of Representative Rufus Rodriguez, I move that the approval of House Bill 426 be deferred. I so move, Madam Chair.
There's a motion to defer the approval of House Bill 426. May I hear a second?
Second, Madam Chair.
Duly seconded. Is there any objection? Hearing none, the motion is approved. I would like to proceed to House Bill 1153, entitled An Act Establishing a Tertiary Hospital under the Control, Supervision, and Management of the DOH in the city of Calbayog, Samar, to be known as the Samar Island Medical Center, appropriating funds therefore and for other purposes. Authored by Representative Yeda Marie Romualdez.
Morning, Madam Chair.
Please proceed, Kong Yeda.
Madam Chair, esteemed colleagues, partners in government, and guests, I have the honor to present for the consideration of this committee House Bill 1153, an act establishing a tertiary hospital under the control, supervision, and management of the Department of Health in the city of Calbayog, Samar, to be known as the Samar Island Medical Center, appropriating funds therefore and for other purposes. Madam Chair, the island of Samar is the third largest island in the country and is also home to 3 provinces, Northern Samar, Samar, and Eastern Samar, and to a population of more than 2 million residents. However, there is not a single government tertiary hospital in the island. Patients and their families have to travel 4 to 5 hours from Northern Samar, 3 to 4 hours from Eastern Samar, and 2 to 3 hours from Western Samar to get to the nearest government tertiary hospital located in Tacloban. With these 3 provinces already having one of the highest poverty incidents in the country, the availability of accessible and affordable hospital care is one of its most pressing needs. The establishment of a DOH-controlled, supervised, and managed tertiary hospital in the island of Samar, specifically in the city of Calbayog, will effectively close the gap in the region's hospital bed capacity, as well as ensure wider access to affordable and quality healthcare services, particularly in Samar Island. Easy accessibility to tertiary health care for our less fortunate Filipinos from the island of Samar is deemed urgently necessary. In view of the foregoing, the passage of this bill is earnestly sought. Thank you very much, Madam Chair.
Thank you, Kong Yeda. May we hear from DOH Region 8, ARD Minerva Molon?
Good morning, everyone. I am really happy to present our position paper regarding the proposed bill of our Honorable Congressman Yeda Romualdez, House Bill number 1153, which is titled An Act Establishing a Tertiary Hospital under the Control, Supervision, and Management of the Department of Health in the city of Calbayog, Samar, to be known as the Samar Island Medical Center, appropriating funds thereof. Currently, there's only one 500-bed DOH tertiary hospital serving the 4.7 million population of the region, which is located in Tacloban City. The first-class city of Calbayog is located in the province of Samar. It is within this city that the proposed Samar Island Medical Center is to be erected, specifically in the proposed government center of the city, located in Barangay Gadgaran. The prospective beneficiaries, however, for the Samar Island Medical Center will extend to the 3 provinces of the Western Samar, Northern Samar, and Eastern Samar, including the cities of Catbalogan and Borongan. In total, the Samar Island Medical Center is proposed to benefit around 2.036529 citizens according to the 2021 population projection of our FHSIS. The Samar Island Public Health Overview would show that there is a heavy burden placed upon the provincial hospitals operated by the 3 provinces to address the health needs of the entire population because they are the core referral hospitals for the district and municipal hospitals in all the interlocal health zones. As can be seen in our table, actually, the table is about the bed to population ratio that the WHO standard is 1.1 bed to 1,000 population. There is the highest among the provinces is that 1 per 2,285 population. So talagang masyadong congested. This proportion is reflected as well as in the personnel manning these hospitals. It stands to reason that if the hospitals are experiencing overpopulation, the same hospital are also experiencing understaffing or patients overloading. The WHO has set a standard of 1 physician per 1,000 population. However, in the Samar Island or the three provinces, there is a ratio of 1:10,337 general government physician to the population. The proposed Samar Island Medical Center is a tertiary hospital which is laudable in its intent and purpose. It is projected that it will eventually result in the betterment not only of the health and wellness of the people, but may also improve the Samar Island's economy by attracting business and private investment, as well as increasing the attractiveness of local tourism based on our feasibility study conducted last February 2020. And other updates expresses its support for the House Bill number 1153 as it proves to be an achievable and realistic approach in achieving not only the health sector's goals of the government, but also the economic and development goals in our efforts to achieve health care for all Filipinos. Thank you very much.
Thank you, ARD Mulon. May I recognize Sir Rod?
Thank you, Madam Chair. Since the Department of Health has not yet finalized its position paper on the establishment of Samar Island Medical Center, let me read, Madam Chair, the position paper of our Bureau, the Health Facility Development Bureau of the Department of Health.
Sir Rod, can you just read the highlights of the draft position of the Bureau in the interest of time?
Madam Chair, we launched the intent of the bill for the establishment of Samar Island Medical Center. And Madam Chair, we need to consider the healthcare provider network in the area before we can go for a establishment of a new hospital, Madam Chair. But the intent of the establishing a tertiary hospital in the Samar Island is necessary for the catchment population, Madam Chair.
Thank you, Sir Rod. Noted your recommendation or position, and please submit the official position paper before we can come up with a committee report. No? May I hear a motion for the approval of this bill? Anyone from the... Go ahead, Kong Jun.
I move for the approval of the House Bill authored by Congressman Yeda Romualdez. I so move, Mr. Chair. Madam Chair.
I second the motion, Madam Chair.
I second the motion as well, Madam Chair.
Approve House Bill 1154, duly seconded. Is there any objection? Hearing none, the motion is approved. Congratulations, Kong Yeda.
Thank you very much, dear colleagues.
Short manifestation, Madam Chair.
Yes, Kong Edgar.
Madam Chair, as a representative of the first district of Samar, where the proposed Samar Island Medical Center will be located, from the bottom of my head, Madam Chair, I would like to thank the Chair for the favorable recommendation, Kong Yeda as well of Team of Party List, and the different resource person. Madam Chair, just for the information of everyone, Albay City is right at the center of the Eastern Seaboard, roughly 600 kilometers to Manila, 600 kilometers to Davao. It's the third largest island in the country in abundance of natural resource. And if ever this will be given to us, Madam Chair, it's going to be a big help. And rest assured that the help coming from the national government will be truly valued by the inspiring Samarans. And we want to contribute as well for the development of this country. Thank you so much, Madam Chair.
Thank you, Kong Edgar. We'd like to proceed on House Bill 1405, authored by Representative Alfred Vargas, entitled An Act Upgrading the Novaliches District Hospital in Barangay San Bartolome in Quezon City and appropriating funds therefore. Do we have Kong Alfred? Kong Alfred Vargas. If none, I would like to move to House Bill number 1583, authored by Representative Amihilda Sangcopan, entitled An Act Expanding the Mandate of Sulu Sanitarium in the Municipality of Jolo, Province of Sulu, to become the Sulu Sanitarium and General Hospital with at least level 2 capability and appropriating funds therefore and for other purposes. Please proceed, Representative Sangcopan.
Yes, hello. Good morning, Madam Chair. Thank you for acknowledging and for including in the calendar of today's meeting of the Committee on Health. Assalamualaikum warahmatullahi ta'ala wabarakatuhu. The COVID-19 pandemic has changed how healthcare is delivered in our country and has affected operations of our healthcare facilities. Sad to note, however, even prior to this pandemic, Sulu has a health facility density of 1:43,407, the highest so far in terms of health facility density in the Bangsamoro Autonomous Region and Muslim Mindanao. Thus, we proposed House Bill 1583 that seeks to expand the mandate of Sulu Sanitarium, which is the only DOH retained and administered hospital in the province. Actually, one of the 2 or 3 hospitals retained in the Bangsamoro Autonomous Region in Muslim Mindanao. The province of Sulu has no level 2 hospital to serve its 824,731 population based on the 2015 census spread all over its 19 island municipalities, which has only 1 level 1 provincial hospital, 5 district hospitals, and 2 municipal hospitals. Sulu Sanitarium caters to the needs of the province of Sulu and Tawi-Tawi, can address the health needs of our people if upgraded to level 2 hospital to be known as Sulu Sanitarium and General Hospital. This is in line with the Philippine Health Agenda, wherein DOH hospitals, including sanitaria, are identified to become tertiary government hospitals. Sulu Sanitarium currently is performing dual expanded role of providing health services to the general public and custodial care to its leprosy patients per DOH Administrative Order number 2005-0013. The expanded dual role of providing health care to the general public and custodial care to its leprosy patients took a toll on the limited resources of this health facility to finance facilities and manpower. It is essential that the legal mandate of Sulu Sanitarium, being the only DOH retained hospital in Sulu and Tawi-Tawi, be upgraded to ensure efficient delivery of health services to the provinces of Sulu and the 19 island municipalities, which has only 1 level 1 provincial hospital, and as I have mentioned earlier on. Sulu Sanitarium currently has about 150% bed occupancy rate from its 25 implementing bed capacity for general service and 50% BOR for its approved 120 authorized bed capacity as sanitarium. Unfortunately, with its 2018 annual budget of only 8.153 million for MOE and 38.3 405 million for personal services, it cannot cope up with its twin functions. So Salud Sanitarium has about 100, as I've mentioned earlier, a 150% bed occupancy rate. It is expected to rise with the increasing health needs of its growing population, of the hospital improvement, and of course, the current situation in our country, the existence of this pandemic. This bill mandates the expansion of Salud Sanitarium into a Salud Sanitarium and General Hospital of at least level 2 capability. More improvement is needed in Sulu to ensure critical health service delivery at the frontline level. Given the remoteness of the province, the said expansion shall improve not only emergency responsiveness, Madam Chair, but also ensure access to quality health service where otherwise there is limited to no access to health care. The passage of this bill, Madam Chair, is fervently called for. At this juncture, Madam Chair, fellow members of this honorable committee, may this representation request that fellow advocate of this bill and the Chief of Hospital of Salud Sanitarium, Dr. Amin Kadra A. Majid, a diplomate of the Philippine Pediatric Society and a fellow in the Philippine Society of Medical Specialists Incorporated, be acknowledged to read their position paper. Thank you so much, Madam Chair, and to all members of this honorable committee. Wassalamualaikum warahmatullahi ta'ala wabarakatuh.
Thank you, Representative Sangkopan. May I recognize Dr. Majid? Position. Dr. Majid, can you just read the highlights or the key points in your position?
Okay. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Otherwise, we should be upgraded to level 2 hospital. Sanitarium is the only leprosy referral center in Sulu. For the past 10 years, Sulu Sanitarium has been a good referral hospital from the different 19 municipalities in Sulu. In fact, we received some referral from Tawi-Tawi and from Sabah, Malaysia. We increased admissions needing level 2 and level 3 service capability. Since we are level 1 and there's no level 2 hospital in Sulu, we are compelled to patients because there's a Republic Act that we cannot refuse admission for patients. And number 4, why we should be upgraded. This is pursuant to the Philippine Health Agenda, taking all the hospitals to a level 2. So as mentioned earlier, World Organization and doctor to population ratio of 1:10,000, but the province of Sulu has barely 1 to 12,310 population ratio. And the bed to hospital ratio of 1 to 500 ratio, but the Bangsamoro Autonomous Region Muslim Mindanao has barely 1 to 4,606 bed to population ratio. We just make it short as requested earlier. Consider Salud Sanitarium 6 be upgraded from level 1 hospital.
Yeah, medyo pangit po yung audio ninyo, I guess doon po sa signal ninyo. Can you just submit po the position paper to the committee secretariat?
Yes, we submitted the other day, Madam.
Okay. Thank you, sir. May I recognize Mr. Rod Dapulan?
Thank you, Madam Chair. We will submit, Madam Chair, the position paper of the Department of Health assigned by our secretary. But just to give you the gist of the position paper, Madam Chair, of the House Bill number 1583, as introduced by Representative Amihilda Sangkopan. So the Department of Health fully supports the proposed measure that seeks to expand the Sulu Sanitarium in Holo Sulu into a general hospital to be known as the Sulu Sanitarium and General Hospital. And Madam Chair, we'd like also to recommend some amendments on the provision in the proposed bill, especially on the Section 4 on the Expansion Committee, on the paragraph A to replace expansion and development scheme with hospital development plan approved by the Department of Health. And in B, to replace by the Health Human Resource Development Bureau of the Department of Health by the Department of Health. And then on Section 5, on the expansion and upgrading of health service facilities to add at the end in accordance with the Hospital Development Plan. And on Section 8, on the implementation to add at the end in accordance with the Hospital Development Plan. And further, Madam Chair, we would like to seek and clarify in Section 2 that Sulu Sanitarium is located in Sulu, not in Sulu and Tawi-Tawi, Madam Chair. Respectfully submitted, Madam Chair. That's it.
Thank you, Sir Rod. Kong Sangkopan, are you amenable to the amendment and recommendation of the DOH?
Madam Chair, yes, we submit to the suggested amendments to the bill. My apologies, medyo masama po yung signal ko, Madam Chair.
Okay, thank you so much. May I hear a motion for the approval of this?
Chair. Madam Chair.
Yes, Kong Matba.
Yes, I move for the approval of House Bill number 1583, Madam Chair.
Second motion, Madam Chair.
Okay, there's a motion.
Second the motion.
I second.
Approve House Bill 1583, subject to style and amendment, duly seconded. Is there any objection? Hearing none, the motion is approved. I'd like to recognize first the presence of Representative Shari Antan and our Deputy Speaker, Representative Aurelio Dong Gonzalez.
Madam Chair.
Congratulations, Kong Sangkopan.
Just a simple message of thanks to everyone, especially to Ate Angel who moved. She too is a daughter of Sulu. So maraming salamat mula po sa lahat ng taga Sulu. Actually, malaking bagay po ito. Ito pong magiging regalo ko sa aking ina. Maraming salamat, Madam Chair, and to all the members of this honorable committee. Thank you po.
Congratulations again. We'll now proceed to House Bill 2686, entitled An Act Creating the Bacolod Negros Heart and Kidney Center and Appropriating Funds Therefore, authored by Representative Greg Gasataya.
Thank you very much, Madam Chair. Magandang umaga po sa lahat at sa mga members and to all our resource persons. Very briefly, Madam Chair, we'll just manifest that the explanatory note of the bill be made as the sponsorship speech. And before I endorse the said bill for the committee's appreciation, Madam Chair, the intention of this representation, I originally filed this bill in the 17th Congress, and now I refiled this bill because we know for a fact that this is already beyond cases, this is already beyond statistics. No? For this representation, Madam Chair, yung access ng mga tao na may cardiovascular and kidney ailments, especially in this part of the country, medyo mahirap. No? For those who would want to have special treatment, kailangan pang pumunta ng Metro Manila to avail the services of our specialized hospitals, Madam Chair. So that is why I filed this bill with the intention of helping and providing access to about 3 million people of Negros Occidental, more than 3 million people of Negros Occidental, as well as to Negros Oriental, which is about 1.5 million. And this does not include yung mga kababayan namin sa Panay Island, Madam Chair. We really see the necessity of having a specialized hospital dito po sa Bacolod at Negros Occidental, Madam Chair. And before I close, while we're having this hearing, just to show how important this is, while we're having this hearing, Madam Chair, a constituent texted me. She is asking for our help because last November, yung anak niya had an operation sa Philippine Heart. Umuwi sila after the operation and they're due for another operation last month. But because of our situation, wala na silang magagawa, Madam Chair. So for me, as I said, this is beyond statistics, this is beyond the cases, this is beyond numbers. A family member had experienced this kind of ailment and it cost her life because during the time, hindi namin sila pwedeng dalhin sa Metro Manila. So this bill is very, very personal to me, Madam Chair. So we submit for the committee's consideration and the wisdom on the bill. Maraming salamat po, Madam Chair.
Thank you, Kong Greg. May we hear from Sir Rod Napulan.
Thank you, Madam Chair. We will submit, Madam Chair, the signed position paper of the Department of Health once signed by our Secretary of Health. But let me give you the overall gist of the position paper of the Department of Health as drafted. So the Department of Health supports the noble intent of the proposed measure on the House Bill number 2686 as introduced by Representative Greg Casataya that seeks to create the Bacolod Negros Heart and Kidney Center in Bacolod City. Madam Chair, the DOH recommends that instead of putting up a establishment of a new hospital, we recommend a rational allocation of resources in a specialty center care services be guided by the Philippine Health Facility Development Plan and the establishment of specialty centers in Corazon, Locsin, Montelibano Memorial Regional Hospital. This is one of the DOH hospitals in Bacolod City, and in Western Visayas Medical Center in Iloilo City, both in Western Visayas, Madam Chair. And in other DOH hospitals in the Visayas will already serve the noble purpose of the proposed Bacolod Negros Heart and Kidney Center, Madam Chair. Submitted, Madam Chair.
Thank you, Sir Rod. May I hear a motion for the approval of this bill?
Madam Chair.
Madam Chair.
Yes, Kong Ruth.
Yes, thank you, Madam Chair. I move for the approval of House Bill 2686, Madam Chair.
There's
I
a
second,
motion
Madam Chair.
to approve House Bill 2686, authored by Representative Taya, duly seconded. Is there any objection? Hearing none, the motion is approved. Congratulations, Kong Greg.
Thank you very much, Madam Chair, and to all the members of the committee and to DOH.
We'll now proceed to House Bill 5501, authored by Representative Maria Angelica Amante Matba, entitled An Act Converting the Agusan del Norte Provincial Hospital in Butuan City, Province of Agusan del Norte, into a Level 3 Teaching and Training Hospital to be known as the Agusan del Norte General Hospital and Training Center, and appropriating funds therefore. Please proceed, Representative Amante Matba.
Thank you very much, Madam Chair. I'd like to say good morning to all the members of this committee and the resource persons who are here as well in the different agencies. Let me start, Madam Chair, by stating that the provincial hospital right now of Agusan del Norte is actually a level 1 medical institution. And right now we have 100-bed capacity. For the past 3 years, the hospital is operating on 124% bed capacity. In fact, Madam Chair, we will base it on the records of the provincial hospital from years 2016 to 2018. The average inpatient service is around 4.5 days. And notwithstanding the fact that we are not only servicing the people of Agusan del Norte, but patients coming outside of the province as well. So it simply shows that the medical services, we do not have any boundaries at all. So because of this, Madam Chair, this bill seeks to convert the Agusan del Norte Provincial Hospital into a level 3 hospital and regional training center for doctors, nurses, medical technologists, midwives, radiologists, and other medical allied professions, which of course shall be under the supervision and control of the Department of Health. Currently, Madam Chair, there are no public and private hospitals with an equivalent of level 3 training and teaching, which has a training and teaching capability in the province of Agusan del Norte and Butuan City, because the provincial hospital is located in Butuan City. The creation of this proposed hospital, if my colleagues will support me on this, will help upgrade the current government hospitals, which are mostly infirmaries. Why? Because we have a major deficiency of trained doctors and other health workers. So when we have this training facility within the zone, we will be assured of a continued supply of medical specialists and other trained workers as well. Madam Chair, and for the information of my colleagues, this hospital will also serve as the most culture-sensitive training facility in Mindanao, because I would like to inform you that Caraga region has 1 million indigenous people. So we have basically 1 million IPs located here in our region right now. And this is very strategic because Butuan City happens to be the central hub of Caraga as well. So my dear colleagues, Madam Chair, I am earnestly seeking your support for this bill.
Thank you, Kong Matba. May we hear from Sir Rod? Rod Napulan.
Thank you, Madam Chair. Since this is a renationalization, Madam Chair, the DOH interposes no objections provided that the criteria are met, Madam Chair. First, local governments express intent to give up its authority over the particular health facility, including its asset like human resources, buildings, grounds, records, and equipment, to the national government. Address the Secretary of Health and course through the corresponding DOH Center for Health Development or regional office. Sangguniang resolution justifying and explaining details of transfer of authority, and with supporting resolutions from the local health board and the local development council. And information on the health facilities condition, situation analysis of the catchment area, financial and other records showing difficulty in providing resources, and records of interventions, strategies, and activities the LGU had undertaken. And also, Madam Chair, would like also to recommend a provision or another section to include that the Department of Budget Management, in consultation with the DOH, Provincial Government of Agusan del Norte, and other concerned agencies, shall determine the cost of renationalized functions relative to the operation of the hospital from its current internal revenue allotment, and thereafter, and cost the allocation of the same to the DOH chargeable against the ERA allotment of the Provincial Government of Agusan del Norte. This recommendation shall complement the implementation of the UHC as aligned with the Philippine Health Facility Development Plan, which shall guide government investments in the health facilities. We will submit, Madam Chair, the signed position paper once it is available. Thank you, Madam Chair.
Thank you, Sir Rod. Representative Matba, yes, go ahead. If you want to respond.
Yes, Madam Chair, I accept the provision to be included in the proposed bill.
Okay.
Thank you,
Madam Chair.
If I may remind lang Kong Angel, kasi as based on the experience nung renationalization natin, nahirapan tayong magpa-approve sa Senate kapag hindi na comply yung requirements stated by the DOH, no? So at least yung first three, I think the Sangguniang Panlalawigan resolution, the letter of intent, things like that. The committee will send you the list of the requirements for you to comply.
I will greatly appreciate that po, Madam Chair.
Okay, Kongging?
Yes, Madam Chair. I'm sure Congresswoman Matba is very much willing to comply with the requirements and to include the recommendation of the DOH in the bill. I move to approve House Bill number 5501. So move, Madam Chair.
There's a motion, there's a motion to approve House Bill 5501. Duly seconded. Is there any objection? Hearing none, the motion is approved. Congratulations, Kong Angel.
Madam Chair, I'd like to say thank you very much, and to all my colleagues, thank you for your support.
Thank you. Let's proceed to House Bill number 1104. House Bill 6775, entitled An Act Expanding the Mandate and Service Capability of Western Visayas Sanitarium in the Municipality of Santa Barbara, Iloilo, renaming the hospital as Western Visayas Sanitarium and General Hospital and appropriating funds therefore, authored by Representative Michael Goreseta. Kong Michael.
Thank you, Madam Chair, and good morning to my esteemed colleagues in the House, especially to the members of the Committee on Health and to the resource persons, guests. Good morning to all. The World Health Organization describes healthcare as a fundamental human right This aims to make healthcare available and accessible to all with standing, distance, status, opportunity, and financial standing. The Western Visayas Sanitarium in the municipality of Santa Barbara in the 2nd District has stood for 93 years, tracing its roots as early as 1927, when it was established as the setting for the treatment of leprosy during that time. At present, it has become a 75-bed Level 1 hospital catering for almost 150 to 160 patients daily. With the number alone, we can easily point out that the facilities and competency of the hospital in adhering to the demand of the healthcare essentials are insufficient and is in the dire need of an upgrade. Despite the desire of the hospital employees to cater to every client, there are always numerous instances wherein the implementation is hindered by lacking of equipment and amenities. It is for this same reason that I desire to increase the bed capacity of Western Visayas Sanitarium from 75 beds to 300 beds. In connection, we're also aiming to increase its manpower by staffing and by creating more positions for healthcare professionals, specialists, plus to provide their corresponding pay and benefits. In the advent of the COVID-19 pandemic, the Western Visayas Sanitarium continues to serve as a COVID-19 referral hospital for mild and moderate cases. Given the rate and the rise of positive cases in Western Visayas, the hospital would greatly need reinforcement, especially in the facilities personnel, which would cater to those affected by the pandemic and at the same time ensure the capacity to render quality health care to patients with other concerns, without sacrificing efficiency and consistency. Given the accessibility of the location and the nearest Level 3 hospital being 13 kilometers away, we could note how the Western Visayas Sanitarium is considered to be the central institution for health among those surrounding barangays and the municipalities. Furthermore, we also emphasize the need to focus on the improvement of our healthcare delivery system. I underscore the essentiality of the competent and secure facility wherein my constituents can receive proper and complete health services, wherein they would no longer need to trouble themselves in conveniently finding an institution that could accommodate in their urgent situations. In this slide, I strongly urge and encourage the passage of House Bill 6775, an act expanding the mandate and services capability of the Western Visayas Sanitarium in the municipality of Santa Barbara, Iloilo, renaming the hospital as Western Visayas Sanitarium and General Hospital and appropriating funds therefore. Thank you, Madam Chair.
Thank you, Kong Michael. May we hear from Sir Rod?
Thank you, Madam Chair. So the Department of Health will submit the signed position paper once available, Madam Chair. But for the general gist of the position paper, Madam Chair, the DOH fully supports the proposed measure as introduced by Representative Michael Goriseta that seeks to expand the mandate of the Western Visayas Sanitarium in Santa Barbara, Iloilo to be known as Western Visayas Sanitarium and General Hospital. And we would like also to propose some amendments, Madam Chair, in the proposed bill. Under Section 2, Sanitarium Expansion, to rephrase the provision with Western Visayas Sanitarium located in Barangay Inangayan, Santa Barbara, Iloilo, is hereby expanded to Sanitarium and General Hospital with specialty services in infectious diseases to be known as Western Visayas Sanitarium and General Hospital. The expansion of its capability shall be in accordance with the Hospital Development Plan approved by the Department of Health. And second, under Section 3, continued service and assistance to leprosy patients to replace leprosy eradication program with National Leprosy Control Program. And under Section 4, upgrading of health service facilities and capabilities to replace the provision with the existing hospital facilities and professional healthcare services of the WVSGH are hereby upgraded and increased to conform to its capability, to its capacity in accordance with the Hospital Development Plan as provided in Section 2 of this Act. House Bill number 6775 with the recommendation above shall contribute to the implementation of the Republic Act number 11223 or the UHC Act as aligned with the Philippine Health Facility Development Plan. to the benefit of the Filipinos in the facilities catchment and the network of healthcare providers therein. Respectfully submitted, Madam Chair.
Thank you, Sir Rod. Kong Michael, are you amenable to the recommendation of the Department of Health?
Yes, thank you, Madam Chair. Yes, I am amendable to the proposal of the Department of Health, and I would like also to recognize the presence here today of our Medical Center Chief, Dr. Judy Ann Dumayas, and also our Regional Director, Director Marilyn W. Convocar. Thank you, Madam Chair.
Thank you, Kong Michael. In the interest of time, because we have a long list of national bills, may we hear a motion from our members?
Madam Chair.
Madam Chair, I move that we approve House Bill number 6775 with amendments and style, Madam Chair. So move.
Second the motion, Madam Chair.
There's a motion to approve House Bill 6775, subject to style and amendment, duly seconded. Is there an objection? Hearing none, the motion is approved. We'll now proceed on House Bill 6965, authored by Representative Mark Inverga, entitled An Act Nationalizing Claro M. Recto Memorial District Hospital located in the municipality of Infanta, province of Quezon, placing under the direct supervision and control of the Department of Health, increasing its bed capacity to 100 and appropriating funds therefore. May we hear from the author, Kong Mark?
Thank you very much, Madam Chair, to our distinguished members of the committee, my esteemed colleagues, our resource persons, good morning. First and foremost, I would like to extend my deepest gratitude to this honorable committee for the immediate consideration and deliberation of House Bill 6965 that aims to strengthen the local health services in the 1st District of Quezon Province. I would also like to take the opportunity to thank our honorable chair, the Honorable Chair Angelina Tan, for taking the time and effort to visit the said hospital, which is Claro M. Recto, in the municipality of Infanta, to engage the direct stakeholders and to see for herself that the importance of this measure. Indeed, it is my pleasure and privilege to give you some of my insights on the importance of my proposed measure relative to renationalizing Claro M. Recto Memorial District Hospital, located in the municipality of Infanta, the province of Quezon, placing under the direct supervision and control of the Department of Health, increasing its bed capacity to 100 and appropriating funds therefore. Claro M. Recto District Hospital is a district hospital serving 3 municipalities in the northern part and 5 island municipalities in the 1st District of Quezon. It is strategically located to cater the emergency healthcare services of the people of these areas, which are about 4 to 8 hours travel to Metro Manila or to the capital, Lucena City. It is either by sea or by land. Yet the hospital has limited resources to maintain the existing facilities, old equipment that are beyond repair and needs upgrade, and limited services, leading to patients referred to other health providers. Furthermore, losses incurred due to non-operational medical equipment and lack of personnel because of inadequate financial resources to fund repair or purchase and additional hiring of health workers are also evident and should be adequately addressed immediately. The renationalization of the hospital would substantially contribute to the revolving role of the hospital to the universal health care by having an optimum clinical performance in case management through incentives mechanism, improve quality of patient care with a good working environment, and access provision to quality healthcare facilities and health promotion incentives. Finally, the hospital needs to be supervised by the national government to ensure continuous funds and aid for the hospital and not to further rely on the funds from the provincial government. In view of the foregoing considerations, I urge the members of the committee to strongly support the passage of this legislation. Again, thank you very much, Madam Chair, for the opportunity and for this being heard at the most efficient manner. Thank you so much, Madam Chair.
Thank you, Kong Mark. Can you mute your laptop or gadget? Okay, thank you so much, sir. May we hear from Sir Rod?
Madam Chair, we don't have the signed position paper, but once available, we will submit, Madam Chair. But for the technical evaluation of the Bureau, so the Department of Health interposes no objection on the proposed measure on the House Bill number 6965 as introduced by Representative Wilfredo Mark Inverga, provided, Madam Chair, that the requirements will be complied. First is local governments express intent to give up its authority over a particular health facility, including its asset, like human resources, buildings, grounds, records, and equipment to the national government, addressed to the Department of Health Secretary, and course through the corresponding DOH Center for Health Development or regional office. Sangguniang resolution justifying and explaining details of transfer of authority, and with corresponding resolutions from the local health board and the local development council. And information on the health facilities condition, situational analysis of the catchment area, financial and other records showing difficulty in providing resources, and records of interventions, strategies, and activities the LGU has undertaken. And lastly, Madam Chair, we'd like also to propose amendment on the bill to include another section such that it will reflect that the Department of Budget and Management, in consultation with the DOH, Provincial Government of Quezon, and other concerned agencies, shall determine the cost of renationalized functions relative to the operations of the hospital from its current internal revenue allotment and thereafter, and cost the allocation of the same to the Department of Health chargeable against the ERA allotment of the Provincial Government of Quezon. These recommendations shall complement the implementation of the UHC as it is aligned also with the Philippine Health Facility Development Plan, which shall guide the government investment in the healthcare facilities, Madam Chair.
Sir Rod, bakit may additional provision ka nun na yung chargeable to the area of local government?
Just to, yes, Madam Chair. The reason for additional section for the bill is to ensure the continuity of the operations, Madam Chair, of the facilities. As
yeah,
we,
this one is renationalization na, di ba?
Yes po, Madam Chair. So para to have a initial budget, Madam Chair, for the hospital, kasi wala pa siyang current budget, kasi once na-transfer sa DOH, mahirapan po kaming, Madam Chair, i-continue yung operations ng hospital. Otherwise, we will discharge all the human resources ng hospital na hindi na siya ma-retain sa facility. So yung observation kasi namin in the past, Madam Chair, nagkakaroon ng hirap doon sa transition, Madam Chair. And we don't have a initial budget din po as also enumerated by the DBM na nagkaroon kami ng meeting.
So this is during transition period.
And kasi, Madam Chair, because of the mandanas din po, Madam Chair, na makakaroon ng budget kasi yung local government unit, additional budget. We also want to ensure na may makukuhang budget din po yung national government kasi may nahihirapan po kami ngayon lalo na kapag limited yung fiscal space for the Department of Health.
But kasi yung sa Mandana sa local government yon. And then ito, renationalization, chargeable to the fund of the national government. No? But based on the experience doon sa HoR, renationalization, so far hindi naman nag-sacrifice yung operational expenses. Nasa regional offices na po yon ang preparation for the budget, no? During transition. But anyway, Mark, do you want to respond to the comment of Sir Rod Napulan?
Yes, thank you again, Madam Chair. But this representation is very much amenable to comply with the requirements stated by Sir Rod Napulan. But again, Madam Chair, may I request from the committee secretariat that I may be furnished a copy of the list of requirements mentioned by our representative from the Department of Health.
Thank you, Kong Mark.
Thank you.
Yeah, Secretariat is directed to forward the list of requirements to all sponsors on renationalization of several hospitals sponsored earlier, no? May we hear a motion?
Madam Chair, Madam Chair.
Yanda.
Considering the intent of the bill as manifested by Congressman Enverga and the response of the DOH, I move for the approval of House Bill number 6965.
Second the motion, Madam Chair.
There's a
I
motion.
second the motion as well, Madam Chair.
There's a motion to approve House Bill 6965, duly seconded. Is there any objection? Hearing none, the motion is approved.
Madam Chair, Madam Chair, sorry, Madam Chair. May I just express my deepest thanks again to everyone, to the Honorable Chair, to Congresswoman Lianda, and to the distinguished members of the committee. Thank you po sa suporta po ninyo.
Congratulations, Kong Mark. I'd like to turn over the chairmanship to Kong Joet Garcia to give way for the sponsorship of my bill. Kong Joet.
Yes, Madam Chair.
Yes.
Good morning to everyone. Next on the agenda is House Bill number 1104, entitled An Act Establishing a 500-bed capacity regional training and teaching hospital in the city of Lucena, province of Quezon, and appropriating funds therefore. May we now recognize our chairperson, Representative Angelina Tan, for her sponsorship remarks.
Thank you, Vice Chair Joet Garcia. This bill was presented already during the, I think, previous hearing, and I propose for the deferment of the approval subject to coordination with the DOH and their recommendation. So I'd like to call on our secretariat to present the substitute bill, and let's hear from the Department of Health for their comment on the substitute bill. So on the screen, we've decided that what we need currently in Lucena City is a establishment of multi-specialty hospital. Since we already have up to level 3 or a general hospital. Since Lucena is strategically located, it will cater patients coming from Bicol region, from Mimaropa, and of course part of Region 4A. That's all, Mr. Chair. I'd like to hear from the Department of Health on their comment of this substitute bill.
Yes, may we recognize our representative from the DOH?
Okay, thank you, Mr. Chair. Let me read, Mr. Chair, the position paper of the Department of Health. It is not yet signed by the Secretary of Health, but is already on routing for signature of our principals, Mr. Chair. It is on the position paper on the unnumbered substitute bill on the 1104, an act establishing a multi-specialty hospital in the city of Lucena, province of Quezon, to be known as the Southern Luzon Multi-Specialty Medical Center, and appropriating funds therefore, as introduced by Representative Angelina Helen D.L. Tan. The Department of Health supports the proposed measure that seeks to establish the Southern Luzon Multi-Specialty Medical Center in Lucena, provided that the Calabarzon, Mimaropa, and Bicol medical centers for health development further justify the need for this facility. Southern regions in Luzon include Calabarzon, Mimaropa, and Bicol. In these regions, the leading causes of death are heart diseases, cerebrovascular diseases, diabetes mellitus, chronic respiratory diseases, and liver diseases. These deaths could be prevented by effective, timely, and appropriate specialty care. However, these specialty services are mostly available in the National Capital Region, which is not accessible to the geographically and economically disadvantaged areas. This limitation in access likely contributes to the statistics showing that over half of the people who died are not attended by medical professionals. Further, 57.23% of persons age 60 and above in these regions on average are disproportionately affected. Based on the foregoing, the DOH recommends the following. In formulating the hospital development plan, include a provision that the DOH, in coordination with the local government units, healthcare provider networks, and other stakeholders, shall determine the comprehensive medical and surgical specialty and subspecialty care services, and shall ensure to complement existing specialty units of hospitals in the southern region of Luzon. Second, specify that in addition to the provision of patient care services, the hospital shall provide research and training programs related to its medical and surgical specialties and subspecialties for the development of the local health system and providers in its catchment areas. And lastly, ensure that the patients from the older population, especially the financial incapable, shall have access to appropriate geriatric care along with the hospital's main professional health care services. We will submit, Mr. Chair, the signed position paper once available. Respectfully submitted, Mr. Chair.
Thank you, Sir Rod. Would our
Mr. Chair.
chairperson like to comment?
Yes, as the author of this bill, I am amenable on the additional recommendations of the DOH and definitely will lead the consultation with other stakeholders for the preparation of possible implementation of this bill if it will be enacted into law.
Mr. Chair.
Yes, go ahead.
Mr. Chair.
Yes, Congresswoman Ging.
Since there is a support from the DOH, may I move for the approval of the unnumbered substitute bill to House Bill 1104, subject to style and amendments, Mr. Chair.
I second, Madam Chair. I second the motion, Mr. Chair.
Mr. Chair.
There is a motion.
Yes.
There's
Mr.
a
Chair.
motion to.
Yes. Mr. Chair, before you rule on the motions, may I just manifest my support and my intent to become a co-author of the said measure, Mr. Chair?
Noted, Congressman Envarga.
Thank you, Mr. Chair.
So there's a motion to, yes. Yes. Yeah, so let me act on the motion. So there's a motion duly seconded to approve the substitute bill entitled An Act Establishing a Multi-Specialty Hospital in the City of Lucena, Province of Quezon, to be known as the Southern Luzon Multi-Specialty Medical Center, and appropriating funds therefore. Is there any objection? Hearing none, motion is approved. With that, and given that we still have many items on our agenda, may I relinquish the chairmanship to our chairperson, Chair Angelina Tan.
Thank you to our Vice Chair, Joette Garcia. I think we still have one local bill, the bill of Representative Alfred Vargas, House Bill 1405. This will be sponsored by Representative June Gato.
Madam Chair.
Go ahead, sir.
In behalf of Congressman Vargas, I have the honor to sponsor House Bill 1405, an act upgrading the Novaliches District Hospital in Barangay San Bartolome in Quezon City, and the appropriation of funds therefore, and let the explanatory note serve as its sponsorship speech.
Thank you, Kong June. May we hear from Sir Rod from the DOH.
Thank you, Madam Chair. So the unsigned position paper, let me read, Madam Chair. We will submit the signed position paper once available. So the Department of Health supports the measure in the House Bill number 1405 as authored by Representative Alfred Vargas. However, Madam Chair, since we need to consider the increase in the bed capacity of the hospital, we would like also to recommend that the bed increase shall be based on the computation that the 260 bed occupancy rate of the hospital and shall be implemented consistently with the hospital's development plan. And further, the DOH recommends to add a section on the hospital development plan as follows. Hospital development plan, so the chief of hospital shall develop a hospital development plan to be submitted to the Department of Health to reflect the developmental goals of the hospital and consistent with upgrading and increase in bed capacity as provided therefore. Please submitted, Madam Chair.
Thank you, Sir Rod. Do we hear a motion for the approval of this bill?
Madam Chair.
Go ahead, Kong Ruth.
Thank you, Madam Chair. Madam Chair, I move for the approval of House Bill 1405 as authored by Representative Alfred Vargas, Madam Chair.
Second the motion.
There's a motion to approve the bill of Kong Alfred Vargas, House Bill 1405, duly seconded. Is there any objection? Hearing none, the motion is approved. I think Kong Ging wishes to manifest something. Kong Ging?
Thank you, Madam Chair. Sa second, dun po sa national bill ako magmamanifest, Madam Chair.
Thank you, Kong Ging.
Madam Chair.
Yes, Kong Chunggalaw.
Yeah, before we take up the national bills, can I make a manifestation and inquiry to the representative of DOH?
Go ahead, sir.
I am constrained to make my manifestation here in this committee. I listened patiently to the comments of DOH on the local bills. Kasi I would like to remind the DOH representative, especially the Health Facility Development Bureau, relative to my bill for the creation or the extension of the HoR Memorial Hospital, the regional hospital in the Cordillera Administrative Region, named after my father-in-law, an extension in Ifugao. The reason kasi, Madam Chair, I'm constrained perhaps to prevent my filing of a resolution to investigate DOH. Kasi of all the provinces in the Philippines, my province is the only province that does not have a provincial hospital since 2010. Yes, and the blame can be squarely placed on the DOH because in 2010, after the 14th Congress, 100 million was placed in the province of Ifugao for the construction of the Ifugao General Hospital. Hindi ko naintindihan kung bakit pinayagan ng DOH na mabid yung 100 million sa 68 million. So natural substandard. Hindi natuloy yun kasi because of substandardness, the next funding of DOH on that, hindi tinuloy kasi substandard ang foundation. And it was work sa the Great Plains ang nagkontrata dyan. USEC and DOH. So instead of continuing the hospital, finishing, ginawa nila morgue at saka nurse facilities. Wala pang hospital. That's why when I came back in this Congress, there was a need for us to file an extension of the regional hospital in Ifugao. Kasi hindi namin maantay. Ngayon,
clarify ko lang, sir. Yung provincial hospital niyo po ay na-renationalize o wala po kayong provincial hospital?
Wala pa eh. Walang ma-nationalize. That's why I am compelled to file the extension of the HoR Memorial Hospital in Ifugao in the eastern side, not only to serve the province of Ifugao, but the eastern side of Mountain Province, Kalinga, and Apayao.
Yes, sir. Your bill is pending for review in the management already. But anyway, Sir Rod Napulan, I don't know kung siya po yung makakasagot kasi iba po yung sa health facilities is supposed to be Director Gorgolon. Sir Rod?
Hindi, Madam Chair, before Rod will answer, kasi ang tuloy niya kasi yan, during the last budget, the Secretary of DOH, Doke, committed the funding to finish the Ifugao Provincial Hospital. Kung ano ang pundo nila na about 70 million, ika-counterpart ang governor ko para matapos. Hanggang ngayon, hindi dinilibre. And with the advent of COVID, kaya ko linabas ito, kasi saan namin pupunta yung mga pasyente namin. The moment lumala ang COVID, naturally, Vizcaya will close its door. Mountain Province will close its doors kasi kulang din ang facility. Paano kami sa Ifugao? Kaya instead of perhaps asking for a resolution to investigate, ang solution ko is perhaps for DOH to fast track. Yung pondo naman walang, the other impelling reason why I'm moving is, yes, we got a commitment of a foreign country to fund that construction and the facilities of that extension, condition na mapas yung bill natin. Kaya may I ask Napulan, Dr. Napulan, kasi we were supposed, nandyan na yung area identified. We were supposed to go and have an ocular inspection with your former COMSEC, pero awa ng Diyos na una. So, and with the advent of the COVID, I hope DOH will consider that and move for its fast tracking.
Okay. Sir Rod?
Thank you, Madam Chair. As
reply on the query of Representative Chonggalaw.
First, Madam Chair, for the budget for the Ifugao Provincial Hospital that was initially budgeted in the past years, we will check on this, Madam Chair. Currently, we don't have that response yet at our level, but we will elevate this, Madam Chair, to the corresponding bureau. And secondly, Madam Chair, on the proposed measure of Kong Chonggalaw on the Extension Hospital, since there is a directive from the EXICOM, the Department of Health, that we are not pushing for an extension hospital. Instead, we are recommending a establishment of the hospital. Actually, may plan na po sana kaming mag site visit in the hospital, but apparently because of the COVID nga po, hindi po natuloy. But as agreed previously po, Madam Chair, instead of extension hospital of the Luis HoR, it's better to have a established hospital na lang po.
Yeah. Which I also recommended to Kong Chonggalaw. But anyway, sir, we will link you to appropriate bureau on funding. But rest assured po, yung bill nyo po ay tinututukan namin. Medyo matagal lang po sa yung pag-route sa management because of this problem on pandemic. But definitely nag-move po yung ating bill.
Madam Chair, I am willing to, for a substitute bill, for the creation then of that hospital as the Eastern Cordillera Medical Hospital. Yan din na agreement. I hope that we can fast track that kasi kami talagang naantala at we are afraid that if lalala ang COVID, saan namin ipunta mga pasyente namin? Na-high blood ang governor ko kasi yung commitment ng DOH hindi di-download. And he was ready with his counterpart.
Okay. Noted, sir. Thank you so much po.
Thank you. Thank you, Madam Chair. That's my only concern. Kung pwede sana ma-fast track natin po.
Yes po. I'll call the attention of the management, sir. Thank you so much po.
Thank you, Madam Chair.
The deliberation of our bills of national concern on the establishment of Philippine Center for Disease Prevention and Control. The first bill is House Bill 6096, authored by Representative Chair Joey Salceda, entitled An Act Creating the Center for Disease Prevention and Control, Providing Mechanisms for Epidemic Control and for Other Purposes. Do we have Representative Salceda? Chair Salceda. Please proceed, sir.
Thank you to my idol and to whose husband is my very good friend. I owe him a lot. So may yung explanatory note ko be used only as my sponsorship speech. Mas gusto ko pa gayahin si Tianggalaw magtatanong tungkol sa BRTTH. Anyway, but since my bill is being called, so thank you very much, Madam Chair, for giving me this opportunity in order to sponsor my bill. Thank you very much to everyone.
Thank you, Council Seda. Next, House Bill number 6383, authored by Representative Teodorico Jaresco, who's celebrating his birthday today. Do we have Kong Jaresco?
Namimigay ng bigas doon sa nakita ko.
Oh, anyway, I would like to call on the sponsor of House Bill 6651, authored by Representative Joette Garcia III. Kong Joette.
Thank you, Madam Chair. Good morning again to everyone. The COVID-19 pandemic highlighted some institutional weakness in our health system, such as disease surveillance, contact tracing, and testing capabilities. Unquestionably, one of our urgent priorities now should be addressing the need for an independent and dedicated central chain of command that can quickly mobilize response to the pandemic as well as to emerging infectious diseases in the future. In my consultations, Madam Chair, with some public health experts, I gathered that one of the main reasons why certain countries have had more success than others in dealing with COVID-19 is the presence of a Center for Disease Control and Prevention, or CDC. Countries that have shown greater success in the fight against the disease hinge their strategy on an extensive testing and early detection of outbreaks. This was possible because they have set up a government agency dedicated solely to disease prevention and monitoring. This is precisely the reason why I am pushing for the establishment of our own CDC that will take over all disease surveillance work. The intention is more than just a simple reorganization of existing structures under the Department of Health. The establishment of the CDC will create an entirely new entity to be complemented by a pool of experts and other personnel selected based on competitive qualifications and standards. This will pave the way for the setting up of a laboratory network with facilities possessing proper biosafety accreditation, with a center serving as overseer and regulator that will absorb the provincial, city, municipal surveillance positions. The CDC will open the doors for expanded testing capabilities. We need more surveillance and testing centers across the country. Local surveillance is the key in early detection, prevention, and response. By setting up our own CDC, we will also be able to establish facilities like the RATM in at least all the major islands in the Philippines. The immediate approval, Madam Chair, of these measures therefore requested. Thank you very much.
Thank you, Kong Joette. Next is House Bill 6655, authored by Representative Cheryl De Loso Montalia. Kong Che.
Good morning to our very beautiful and industrious, hardworking chairperson, my sis, Kong Helen Tan, and of course to all the members of the Committee on Health and all the guests. First of all, I would like to thank our chairperson for including in today's agenda my proposed measure and also the opportunity to sponsor this. May I be allowed, Madam Chair, to read my sponsorship speech? I beg the indulgence of our chairperson and the members of this honorable committee, because my sponsorship is a little bit long. I just want to emphasize what I believe are the important features of this proposed measure. Okay. Good morning once again, Madam Chair and fellow legislators and all our resource persons. Our knowledge relating to the SARS-CoV-2, the pathogenesis resulting from its infection, risk factors, dynamics of its transmission, and epidemic control is increasing, and sociocultural factors have emerged as critical determinants for the success and failure of our control efforts. It is time that we veer away from piecemeal legislations and focus on proactive and comprehensive approaches in dealing with not only with this disease, but with all diseases. It is time that we embrace the One Health approach in holistically addressing the problems of our public health system. So this is the thrust of the bill which I filed. The globalization has made the world a small neighborhood where people can easily interact with each other without facing serious barriers. The free movement of people, the goods and services which result from globalization not only stimulated socioeconomic development, but also propagated the spread of diseases, particularly in the countries where proper healthcare measures are not in place to prevent the spread of diseases to general public. The Philippines is no exception to the double-edged impact of globalization. As with most countries in the world, it now faces a serious economic challenge due to the COVID-19 pandemic. Since the start of this global health threat, every day brings a new reminder of our country to the extremes. Those having sufficient and accurate information about COVID-19 vis-a-vis those having bereft or minimal information about the disease, and it highlights the flaws and deficiencies of our public system in one hand and the room for its improvement on the other. Addressing health system inefficiencies and health inequities brought about by the very characteristic of our health system remain critical challenges in the Philippines. The fragmented nature of our health financing, devolved nature of our service delivery, and the mixed public-private health system pose immense challenges to correcting the inefficiencies and monitoring the performance of our health sector. These flaws of our public health system have been highlighted in several occasions in the past. The surge in dengue cases in 2019, the HIV epidemic, and the reemergence of polio. These are only few of the diseases which give a telltale sign of how destitute our public health system is. The COVID-19 pandemic caused by this virus has closely magnified the pre-existing conditions affecting the most pauperized and peripherized sectors of the Philippine society. In the crafting of this bill, I was particularly conscious about the holistic approach in dealing with the problems of our healthcare system. I was also guided by various epidemiologic principles. At the center of its endeavor is the coordination among the pillars of epidemiology management, the epidemiologists, the clinicians, the laboratory, and public education about the epidemic. In the control and prevention of epidemic, actions must be geared towards the removal of source of infection, the prevention of transmission, and institution of vector control measures. The interrelationship of these pillars, as well as the role of the media, will define the effectiveness of our response to an epidemic. The interplay of coordination efforts will effectively guide authorities in their decision-making process. The crafting of the necessary and appropriate rules and regulations on how to combat an epidemic, the establishment of infrastructures for epidemic management, and the use of vaccines or chemoprophylaxis to contain the same. In putting the paradigm into action, formulation of plans for the prevention and control of epidemics must be in order as provided in Section 8 of my proposed measure, House Bill 6655. This provision is in relation to Section 24, which shall be used to deliberate on major policies in the control and prevention of infectious diseases. Using the said plan, LGUs will be required to formulate and implement the respective and implementation plans based on the master plan of the DOH. Included in the master plan are logistic planning, drugs, immunizations, and reagents, manpower planning, the setting up of surveillance centers, health education to public through media, training, and pooling of medical and paramedical staff. The control, prevention, and appropriate specific management of diseases and epidemics will be effected under the auspices of the Centers for Disease Control and Prevention, an institution which is tasked to study, using available scientific data, the pathogenesis, management, and prevention of diseases, both infectious and non-infectious, as well as the timely, all-inclusive, and systematic approach to the management of outbreaks and epidemics, with the end view of having a proactive approach in the management of our public health system and deviate from the reactive and defensive strategies that we are currently using to combat this pandemic. As provided in Section 10 to 23, various divisions and bureaus under the umbrella of the CDCP shall be established, namely Occupational Safety and Health Division, the Public Health Science and Implementation Division, and under this division are the following bureaus: Bureau of Indigenous Peoples Health and Health Equity, Preparedness and Response Bureau. Also, Public Health Science and Surveillance Division. Under this division are the following bureaus: Laboratory Science and Safety Bureau, Surveillance, Epidemiology and Laboratory Services Bureau, Health Statistics Bureau. Also, Non-Infectious Disease Division. Under this division are the following bureaus: Birth Defects and Developmental Disabilities Bureau, Chronic Disease Prevention and Health Promotion Bureau, Environmental Health and Toxic Substances and Disease Registry Bureau, and Injury Prevention and Control Bureau. Also, Infectious Disease Division, which includes Immunization and Responsibility Diseases Bureau, the Emerging and Zoonotic Infectious Diseases Bureau, HIV/AIDS, Viral Hepatitis, STD, and TB Prevention Bureau. At this point, Madam Chair, I would like to emphasize that the CDCP, under this proposed measure, shall be independent and distinct from the Virology Institute of the Philippines, and provided in another legislative measure which we authored. For the record, the VIP shall exclusively do pilot studies on viruses and their applications in medicine, technology, and industry, while the research arm of the CDCP shall conduct researches involving human subjects and human trials of vaccines and medicines, which may be developed by the VIP. It cannot be denied that in countries such as ours, we have to live with what we have. But this does not mean that we will not allow room for improvement. This holds true especially now where we see how the germ is able to put the world at a standstill, infect the rich and famous and powerful. Oh my God. Saan ako? Teka, nawala ako. Am I still on, Madam Chair?
Yes.
Sorry for that interruption. The famous and powerful disrupt our supply chain and cripple our economy. Thus, in addressing this problem or any infectious diseases process, which may possibly turn into an epidemic in the future, we must be guided by the epidemiologic triad. In the said triad, the relationship between the agent and the host and the environment collectively define the outcome of our prevention, control, and management of epidemics. In the disease process, particularly those caused by infectious agents, the triad must always be holistically considered. Otherwise, the disease process may continue to progress. This is where the principle of the chain of infections come in. The chain of infection is a process that begins when an agent leaves its reservoir through a portal of exit and is conveyed by mode of transmission and enters an appropriate portal of entry to infect a susceptible host. Using this chain, we can see that every disease has certain weak points that are susceptible to attack. The basic approach in controlling a disease is to identify these weak points and break the weakest link in its chain of transmission. This will effectively stop the spread of infection. With this in mind, there are measures pending results of epidemiologic investigation to prevent the spread of infection. These are interventions which target the reservoir or source of infection, the route of transmission, and the susceptible host or the people at risk. Elimination of the reservoir may be pretty easy with animal reservoir, but is not possible in humans, whom the general measures of reservoir control comprise early diagnosis, notification, isolation, treatment, quarantine, surveillance, and disinfection, which are all directed to reduce the quantity of the agent available for dissemination. Early diagnosis in the first step in the control of communicable diseases. Section 70 of this bill requires the use of the gold standard in the diagnosis of an infectious disease. Next is notification, which is important in order to put into operation these disease control measures. This is an important source of epidemiological information, which will enable early detection of outbreaks, which permits immediate action to be taken by health authorities to control its spread. Sections 26 to 30 of House Bill 6655 discusses in detail the framework for the early detection, notification, and reporting of infectious diseases. Once cases are identified, isolation will be done. Isolation is a barrier approach to the control and prevention of infectious diseases. It involves the separation for the period of communicability of infected persons from the healthy population to prevent or limit or indirect transmission. Quarantine, on the other hand, is the limitation of the freedom of movement of persons exposed to communicable disease for a period of time longer than the longest usual incubation period of the disease. The framework and protocols for these two aspects of infection controls are discussed in details in sections 86 to 92 of the bill. Treatment is another aspect of infection control. Treatment is designed to reduce the communicability or cut short the duration of the disease and prevent the development of secondary cases. This may be done individually or in mass. The framework for the medical treatment and or management of infectious diseases is discussed lengthily in section 64 to 67 of the bill. Prompt medical intervention and the crafting and use of interim protocols for the medical management of newly emerging infectious diseases are also outlined in section 64. Epidemiological investigations are done to identify the source of infection and the factors influencing the spread of disease in the community. The protocols and guidelines for the conduct of epidemiological investigations, epidemic control, epidemic prevention, quarantine inspection, as well as the officers who will conduct such activities are clearly defined in sections 81 to 85 of the bill. Also discussed is the issuance of temporary duty orders to medical officers and allied medical professionals to perform the functions of epidemiology, investigation control, and prevention officers. As regard the interruption of transmission, this aspect of disease prevention and control is vividly narrated in sections 55 to 80 of the bill. It covers the institution of crisis control measures in cases of outbreaks and epidemics, the establishment or designation of infectious disease control institutions, epidemic control measures, disinfection notices and conduct of disinfection, stockpiling of essential medical supplies and equipment, and prioritization of distribution and the proper, timely, and appropriate management of vulnerable individuals, as well as persons deprived of liberty, internally displaced persons, and locally stranded individuals and OFWs. Non-specific measures, which include lifestyle modification, sanitation, nutrition, and education, are also discussed. The protocol and the conduct of contact tracing are also well defined in sections 31 to 39 of the bill. Included are the provisions of the surveillance of infectious diseases, the establishment of sentinel hospitals, and the use of all available resources in the tracing of contacts of cases. Section 43 to 54 delves on vaccination, and the human trials of locally developed vaccines. It clearly defines the protocols on the conduct of regular and special vaccinations, record keeping and reporting of vaccinations by schools, clinics, and other sites of vaccinations, epidemiological investigations on vaccinations, vaccination injury investigation, and establishment and operation of an integrated vaccination management system. 2 more pages, Madam Chair. Sections 40 to 42 defines the management of highly risk pathogens. Section 93 to 95 covers the management of information, the establishment of information management system, and the observance of confidentiality and the perusal of personal information of patients and cases. In anticipation of the possibility of failure to contain a contagion, which may result in the progress of an outbreak into an epidemic and eventually pandemic, the application of basic principles of epidemiology shall be regularly reviewed for correction of errors. Above and beyond the psychological and emotional trauma caused by an epidemic and pandemic, their socio-economic costs are a result of epidemic of fear and panic. The impact of this epidemic of fear and panic can result into an economic recession if not properly addressed. With the progress of the pandemic curve, there is a corresponding growth in the epidemic of fear and panic. Hence, the socio-economic management of epidemics and pandemics must be put in place and are thus outlined in Section 96 to 99 of the bill. Penal provisions are provided with stiff penalties in order to ensure compliance to the provisions of this proposed law. How do we as a country then address this problem today? Are we prepared for a similar scenario in the future? These are some of the questions that vacillate in the four corners of our mind. We cannot be left defenseless in the face of the realities that we are in. In our continued struggle for survival, we have to adapt to our surroundings. In our adaptation, we must have all necessary tools and faculties for us to be certain of our perpetuation as a species. This piece of legislation is one of those tools, Madam Chair. Before I end, I would like to recognize the significant contribution of the following in the crafting of this proposed comprehensive public health management bill or measure. The Western Visayas State University College of Medicine, batch 2003, and the Division of Biological Sciences, College of Arts and Sciences of the University of the Philippines in the Visayas. For those above reasons, Madam Chair, this sponsor requests the immediate passage of this bill. Thank you very much.
Thank you so much, Kong Chair, for that very comprehensive presentation. Thank you so much, and to those who helped in crafting that bill. I would like to recognize Representative June Chipeco. Do we have Kung June for House Bill 6711? If none, we'll proceed to House Bill 6718, representative by Representative Ferdinand Hernandez. Yes, Hernandez. Do we have the S. Hernandez? If none, we'll proceed to the bill of Representative Vargas, House Bill 7013. Next, House Bill 7243 by Representative Jumel Anthony Espino. Okay. Next is House Bill 7290 by Representative Tambunting.
Madam Chair.
Yes, Kong June.
Congresswoman Joy Tabunting is not available, so I was asked to endorse the sponsor the bill. So in behalf of Representative Joy Tambunting, I have the honor to sponsor House Bill 7290, an act establishing the National Disease Management and Prevention Authority and the appropriating the funds thereof. And let the explanatory note serve as its sponsorship speech. Thank you, Madam Chair.
Thank you, Kong Jun, for sponsoring House Bill 7292. I'd like to turn over the chairmanship to Representative Joette Garcia to give way for the sponsorship of my bill.
Thank you, Madam Chair. I'd like to recognize our chairperson, Representative Angelina Helen Tan, to sponsor her House Bill number 6633.
Thank you, Mr. Chair. Good afternoon. It is my honor to sponsor House Bill 6633, otherwise known as Modernization of Public Health Emergency Preparedness Act. I filed this measure fully aware that the Philippine health system, just like the great majority of national health systems in the world today, is obviously ill-prepared to address the challenges of COVID-19 pandemic. We are stumbling to handle the large influx of COVID-19 patients, and we will continue to do so with future respiratory pathogen infections unless we do something now to upgrade our capability to face major health emergencies like this pandemic. The bill seeks to modernize the country's capabilities for public health emergency preparedness and strengthen the current bureaucracy that is mandated to address communicable diseases in the country through organizational and institutional reforms. To better prepare against public health emergencies, we need to embark two essential initiatives: health modernization and institutional reforms. I think this is what makes this bill different from the rest of the bills on the similar subject, the health modernization component. Mr. Chair, we cannot merely keep on rearranging the boxes within our health organization without capacitating our health personnel and resources. That will not work. We need to modernize and reorganize our health system to protect the public health or the public from health risks. House Bill 6633 proposes the creation of Public Health Emergency Services Modernization Program, which will undertake necessary reforms in the recruitment, training, employment, and management of the country's public health emergency personnel, acquisition and upgrading of appropriate technologies, laboratories, and equipment, and provision for the needed relocation, improvement, and construction of facilities to enhance the country's preparedness and response to public health emergencies. But along with other measures on the subject we have today, the measure also aims to establish a Center for Disease Prevention and Control, which will serve as the principal agency mandated to develop and apply communicable disease prevention and control initiatives. This move essentially removes the function of addressing the communicable disease concerns from the Department of Health and transfers the same to CDPC, which will absorb the existing Disease Prevention and Control Bureau, the Epidemiology Bureau, the Disease Emergency Management Bureau, the Bureau of Quarantine of the Department of Health, including the RITM or the Research Institute for Tropical Medicine. The CDPC will be attached to DOH for policy, planning, and program coordination. In doing so, the country will be able to provide a specialized agency for addressing communicable diseases. The bill further provides for the upgrading of the authorized bed capacity of RITM to 100 beds, where one-half of its bed capacity will be used as negative pressure isolation rooms. It also seeks to establish RITM branches in Luzon, Visayas, and Mindanao. Moreover, following Taiwan's model, considered to be among the best globally in COVID-19 response, the measure seeks to establish a public health emergency command center, which will serve as a physical location or virtual space where the designated public health emergency management personnel assemble to coordinate operational information and resources for strategic management of public health events and emergencies. Thank you, Mr. Chairman, and I am counting on everyone's support for the speedy and favorable consideration of this proposed legislation.
Thank you, Chair Helen. So before we proceed with the deliberation of this very important bill, may I return or turn over the chairmanship again to, ako na ba? Ako na, okay. So may we now hear comments from our resource persons. Siguro unahin na natin ang DOH.
Thank you, Mr.
Yes,
Chair. Can I have the
Mirna.
floor?
Yes, you're recognized, Yusek Mirna.
Thank you. Magandang hapon po at magandang hapon po sa lahat ng honorable members of the House of Representatives who are here. We will submit our position paper once signed by the Secretary. I will read it with some highlights because it's a little long, and highlight on the more active parts or the recommendations. So the Department of Health supports the intention of the proposed measures, the different bills that seek to create the Philippine Center for Disease Control and Prevention. It's the Philippine CDC. Establishing the Philippine CDC will help ensure that the Philippines health system is well prepared, as you have all mentioned in the sponsorship bills, anchored on evidence-based program strategies, highly technically knowledgeable and skilled manpower, state-of-the-art laboratory and clinical facilities, continuous research and development, and training. As in other countries, the CDC provides science-based leadership and technical expertise and coordination of the country's public health activities. And the COVID experience has been an opportunity for us to look at what is happening, and this has been expressed by the various, the different authors of the bill. So may I go directly to the recommendation? The DOH recommends the following to ensure that the proposed measures will complement the Universal Health Act and the mandatory reporting of notifiable diseases and health events Public Health Concerns Act. The first one is the core principles of the public health response to health emergencies, and some of these have already been mentioned in the sponsorship speeches. Number one is responding through a whole of government, whole of system, and whole of society approach to align all national framework and strategies. Number two, given our current evolved setup, to have a national government-led, enabled, local government-led, and people-centric response. Again, national government-enabled, local government-led, and people-centric response. And number three, strengthening local response capacity and implementation, because we know that as the country strives to promptly identify and respond to emerging and re-emerging diseases, there is a need to simultaneously strengthen the health system response at the local levels. The second area is the organization and human resources of the Philippine CDC. Again, this has been emphasized. We propose the alignment to align the creation of the Philippine CDC with the current reorganization efforts of the National Health System as mandated by the Universal Health Act. If we can do this in a phased approach in terms of structure and staffing, and to create staffing plans and mechanisms for the CDC national as well as local units through the provincial and city-wide health systems, and consider partnership with educational institutions for the sustainable production of epidemiologists. Number two, the laboratory network, as has been so rightly described, to provide a new state-of-the-art facility that will serve as the national reference laboratory, unifying all our national reference laboratories for infectious diseases under one roof. Second, to develop a centralized coordinating office to manage laboratory surveillance networks, complete with robust laboratory information system, linking all public health laboratories from the national reference lab down to the provincial laboratories. And if we can establish a regional public health reference laboratories, as well as strengthen the lab capacities and services of the National Health Laboratory Network of the DOH, and improve linkages with regional and national reference labs, animal, food, and environmental laboratories, especially considering the archipelagic nature of our country. The next area is on surveillance and data management to ensure that we have positions for the items. We have re-engineered and streamlined our organization, rationalized in the past. We want to ensure that LGUs have also functional community-based disease surveillance system. And if we can move fast on to digitize, automate, and integrate national and local surveillance system, and to consider One Health in the development, improvement of these systems, especially for zoonosis of public health importance, to enable linking with the animal health surveillance program. So it's not only what is happening in among humans, but also we know that there are diseases that transfer from the animals to the humans. And our last area is on developing surge and sustained capacities for epidemiology, surveillance, and coordinated response to public health events, so that we are able to implement strategic recruitment and retention and capacity building of field epidemiologists, medical technologists, data managers, and other health and non-health professionals, and to ensure that the staffing and augmentation are aligned with our national health human resource roadmap vis-a-vis our universal healthcare implementation. Respectfully submitted, Mr. Chair. Thank you very much for the opportunity.
Thank you, Yusek Mirna. Yes, Kong Joey, Chair Joey.
Wala eh. Para, sino nagsulat nun? Yusek Mirna?
Sir, it was a consolidated response from the various offices and integrated by our DLLO. This is the Legislative Liaison Office po.
Ganun ba? So, sinabi niyo ba yan kung magiging independent siya o hindi?
No, not independent, but it is aligned. It's a standalone CDC po yun, sir. Still under the DOH or attached to the DOH. But we have not really mentioned it because the different proposals are also different.
Ano problema kung tayuan nyo na? Kung ayaw nyo independent, hindi sana sinabi nyo na. Pangalawa, ano yung ibig sabihin mo ng face tapping pattern? Para pahihirapan nyo pa. Pero nasa kongreso naman yan. Pero siyempre, kailangan namin yung guidance namin kung anong predisposition ng DOH with respect to what you call face tapping pattern. Tapos, inano mo pa, hierarchical by spatial hierarchy nyo pa. So let's start with the stopping pattern. What do you mean by stopping face stopping pattern? Ano ibibigay nyo dyan sa TDC? Yung EB, ibibigay nyo ba? RITN?
Hindi, sir. Hindi, sir. Ang ibig sabihin ng face stopping pattern, kasi alam po naman natin sa civil service at saka sa DBM, marami tayong proposal for stopping pattern. But at least for
wala akong pakialam sa kanila. Kung ano kailangan mo, ibibigay na. Wala akong pakialam sa kanila. Ang pakialam ko kung ano kailangan mo para hindi ka masisi. Ano ibig mo sabihin ng face stopping pattern? Ano ba kailangan ng CDC na to para mag-work? Yung EB ba, ibibigay nyo dyan?
It's not just it's not just pooling, sir, the different offices, but trying to align them on what we propose to be the different bureaus or centers in the CDC, and then we will have a different plantilla and staffing position. but we are aware that it cannot be provided. So yun po ang ibig sabihin ng phase. At least the critical should already be started. We are not only giving the EB, sir. We will all give what is required, but then it will not be the full complement, sir.
Answerable na lang ako ba yes? I know, but you know, given the constraints, the fiscal constraints of this government vis-a-vis the massive demand for expertise and institutional response in our current situation, are you giving the existing Epidemiology Bureau to the so-called CDC? Yes or no?
Yes, sir. It will be part of the CDC.
RITM, are you giving up RITM?
Yes, sir.
Are you giving up the communicable disease emergency, the communicable disease control and prevention bureau, or are you giving the?
Yes, sir. The whole of the. Yes, sir. It's the DPC, the DPCB, but we will have to, sir, the position whether it's just the infectious or the non-communicable, because in some CDC, in the US CDC, they have included the non-communicable as part of their CDC. But
bakit mo bigyan mo nga ako ng dahilan bakit yung non-communicable? Ibang-iba yung kanilang mandato, ibang-iba yung expertise na kailangan, ibang-iba ang kanilang activities at functions. Bakit mo isasama yung NCD? Ano?
Because because they are. Yes, sir. Because they have the same surveillance. There's the same.
No, then we have to suppress. You know, it's duty that function. You know, it is duty first. Function follows duty, and finance or organization follows function. That is the way. That is the new modern organizational design, the OD doctrine that must guide the creation of new offices, especially with respect to new demands by the realities this government is currently operating. So at least I'm hearing it from you. So independent ba siya kay DOH? Sir, ma'am?
What is being proposed, sir, is that the Philippine CDC will be an attached agency of the DOH. It cannot be led by an institution independent from DOH because we will need to link somehow, sir. But it has a separate budget appropriation and clear governance
don't worry
structure.
about appropriation. That is the job of Congress. What we need is what will make it work. But it make it more proportional and more responsive to the problems we're facing. So yung Bureau of Quarantine, ibibigay nyo rin ba dito sa CDC? Ma'am?
Yes, sir. Yes, sir.
Okay, thank you. At least we know. So, ang point ko dyan, hirap na hirap tayo nun. Paano kayo nag-declare? Saan galing yung powers nyo na pigilan ang magkaroon ng travel ban? Ang DOH Secretary. Remember February 2? The Secretary went to Congress and he was asked whether he is recommending a travel ban. Don't you think that this CDC should have the power to recommend a travel ban or at least impose a travel ban?
Yeah, yes, sir. It's the CDC, but short of the CDC, at that moment we have the interagency task force that was created by.
Don't you think we should institutionalize the interagency task force in order to provide the DOA the necessary arm, as well as the necessary inputs, as well as the necessary whole of government approach, which is your #1 principle? Diba? Anyway.
Yes, sir.
So, don't you think that we could say, I don't know, you can name it, I'm calling it Health Emergency Coordinating Council, but so you can declare your own state of health emergency, you can declare your travel bans, everything. So anyway, I'm taking too much of your time because there are other people who should be asking, you should be, sorry Joet, if I, kasi I just took advantage that, kasi I found the explanation from the DOH, parang hindi nila, it was not so clear exactly which parts of the elephant they wanted and which part of the elephant are they describing. So I just wanted to know at least, the parameters within which that the DOH is now, as we evolve the concept of this CDC. Pero I take exception, if at all, that the non-communicable should really be separated because that should stay with DOH main because you have the reach and you have the personnel, whereas itong isa, there are two animals differently. Non-communicable diseases and communicable diseases require different institutional approaches, and therefore it should be separated. It should not be included in the CDC. Anyway, that's it. Thank you very much, Madam Chairman and Mr. Chairman.
Thank you, Chair Joey. I think the Chair Helen would like to be recognized.
Thank you, Mr. Chair. Thank you kay Chair Joey Salceda for raising that concern. I think Yusek Mierna, that's one thing that we need to determine if kasi may mga iba-ibang model yung CDC. So yeah, may CDC na yung communicable and non-communicable diseases are included, no? So but in the Philippines siguro kung ano yung fit sa atin, ang primary concern natin kasi yung sa infectious and communicable diseases, and sobrang broad yung kailangang i-cover mo. Kailangan bang isama natin yung communicable diseases pa dito sa creation natin ng CDC. So we need the help of DOH to study this further, no, and all other stakeholders na mag-participate po in the technical working group. But in most of the proposal kasi we did not include the NCDs, no? Yung NCD division natin in the DOH, hindi na natin isinama dito sa proposal. Thank you.
Thank you, Chair Helen. If our members would like, how we can proceed first with some comments from our resource persons. First is RITM. Second is RITM kay Dr. Carlos.
Good afternoon po.
Good afternoon. Please proceed.
Sir, we included some suggestions to the position paper presented by Yusek Mirna. We had a section on organization and human resources of the Philippine CDC, where we enumerated some of the proposed bureaus and units of the DOH, which we are proposing to include in the CDC, which in our interpretation should only cover infectious diseases. So this will include the Disease Prevention and Control Bureau. Basically, they will be designing, implementing, monitoring health sector plans for various infectious diseases and other emerging and re-emerging infectious diseases. RITM will be known as the National Institute for Infectious Diseases, and we propose to include as its terms of reference, conduct of research in various aspects of infectious diseases, epidemiology, treatment, prevention, operations research, disease pathogenesis, diagnostic tools, and testing strategies. It will also house an infectious disease hospital for containing diseases caused by highly pathogenic novel pathogens. And it will also design and conduct training on research, laboratory and clinical management, and produce technical documents on diagnosis and treatment, especially of diseases of high national and international concern. A third unit we propose is a National Reference Laboratory and Public Health Lab Network. They will be an independent facility from the current RITM, and the reason for this is its responsibility and tasks are enormous, as we have appreciated in the current outbreak. It will do confirmatory testing, provision of quality assurance programs of laboratories, evaluation of in vitro diagnostic medical devices, conduct of research, and provision of technical inputs for capacity building programs for laboratories, and implement lab-based surveillance. The next unit which we propose to include will be the Epidemiology and Surveillance Bureau and the Public Epidemiology and Surveillance Network. And as the name implies, it will be in charge of being the lead agency for surveillance, and will be mandated to exercise technical supervision over local epidemiology and surveillance units. And the last unit we propose to include is the Health Emergency Management Bureau, which will serve as a dedicated institution that will ensure unified and integrated implementation of response, especially in local government units for incidents constituting health emergencies or with potential of becoming health emergencies. So those are our proposed units to be included in the CDC. The rest of the points raised by Yusek Kabutahi have been already articulated, and we agree with them and will not dwell into them anymore. Thank you.
Thank you, Dr. Celia. May we now listen to briefly some comments from other national government agencies.
Mr. Chairman.
Yes.
Undersecretary Paras of the Presidential Legislative Liaison.
Yes, Yusek.
If I may say something po.
Sige po.
Well, Madam Chairman, Congressman Garcia, I just would like to put on record the statement of the President in the SONA concerning the creation of this National Disease Prevention and Management Center or whatever, no? But the President was very specific that the creation of this office can either be an authority or a department. This is a statement of the President, and I want to put it on record in the committee. He says that COVID-19 will not only be the last pandemic. We need to create a National Disease Prevention and Management Authority to better respond to future outbreaks. We count on Congress' full support. You can just let it remain for a while in the Department of Health kung wala pang pera, but you have to expand the services, or it will also entail a little bit of money, but not really as much as expensive when you set up a department. In the long term, the President said, we are looking into the creation of the National Disease Prevention and Management Authority to better prepare for pandemics, protect lives, and allow development to proceed even in the worst of times. We are counting on the full support of Congress for this critically important endeavor. I don't know, but I leave it to Congress to really, it's another department. There seems that it could be a multi-layer, redundant thing between the health and the proposed department. So from the discussion and also from the very well-meaning statement of the congressman from Bicol, Congressman Salceda, it would seem that the President envisioned that some functions of the Department of Health should now be consolidated into another authority or department to address this problem, because it was only this time that because of the pandemic that we realize the importance of these offices or the functions of these offices. So perhaps the center that we are now envisioning might be expanded into an authority or a department. Yun po ang pinaparating ng ating Pangulo, and I'd like to express this and be put on record in this committee while we are discussing the creation of prevention office, so to speak. Yun lang po. Marami po salamat, Madam Chairman, Mr. Chairman.
Thank you, Yusek Paras. Well noted po. May we call on DFA if they're here? Magsasalta po ba, magko-comment si Ms. Fatima Tintin?
Mr. Chair, hello?
Yes.
I will deliver the statement on behalf of the FA po. This is Principal Assistant Kevin Gomez.
Okay, please proceed.
Thank you, sir. Good afternoon, Mr. Chair, distinguished colleagues in government. The DFA supports the bills that highlight and consolidate efforts to control and prevent diseases in the Philippines, as these proposals provide proactive measures for dealing with future health issues, which, if passed into law, will help address. With regard to the following provisions referred to the DFA, the department conveys the following. 1. The proposed role of the department is consistent with its mandate to promote international cooperation. It would be useful to cooperate with other states as well as intergovernmental mechanisms and international organizations in matters of research and disease prevention. The proposals to include the Secretary of Foreign Affairs as a member of the Health Emergency Coordinating Council in relation to the Center for Disease Control and Prevention is also found to be in order. Second, the Department of Foreign Affairs, through the Office of the Undersecretary for Migrant Workers Affairs, is also already coordinating with the Migrant Health Unit of the Department of Health on health and medical related issues, which includes but not limited to medical repatriation of OFWs, continued medical assistance to repatriated Filipinos, and information sharing. Efforts to strengthen this cooperation are then encouraged. Number 3, the Philippine government will benefit from multilateral and bilateral international cooperation to improve its health sector, including medical research and development, trade of goods, such as pharmaceutical products, medical equipment and supplies, education, etc. We would also like to emphasize under international cooperation that we are members of various international organizations, such as the World Health Organization and the International Vaccine Institute. Finally, may we also mention the importance of the International Health Regulation of 2005 and continued engagement with WHO. In a related hearing on the creation of a global health emergency unit, the DFA's inclusion is linked to the proper coordination on travel restrictions, among other international cooperation initiatives. We also like to mention that the UN system and its affiliated agencies have other non-health help to offer, such as what the UN Secretary General is doing with his policy briefs, as well as Philippine compliance, not just with the health regulations of the WHO or the International Health Regulations of 2005, but other socioeconomic guidelines declarations from UNGA declarations. Notwithstanding the department's general support, may we also convey the following inquiries or clarifications. The DFA would like to, number 1, inquire whether proponents have looked into or studied the structure of other countries' CDCs and its working relationship with national or local authorities, because such structures, powers, and functions is at the center of criticism against some CDCs in other countries. We also note that these CDCs are often expert-driven and exercise varying levels of independence and power. Offhand, we invite the honorable proponents to use as case studies or models the CDCs of the United States, Europe, China, the Republic of Korea, among others. There is also the possibility of involving pre-existing ASEAN mechanisms on health. Second, we would also like to flag the use of the term repatriation, as this connotes a return to a person's home country from a foreign land. We would like to further qualify, for instance, if in the present context of the COVID-19 pandemic, what we refer to are LSIs, because this would have attendant meanings, especially in UN bodies. We also would like to seek clarification on the term IDP, as depending on intended meaning or the necessity, the department may overstep in the purview of other relevant agencies unless it will involve certain vulnerable sectors that may trigger UN mechanisms or the latter's resources assistance staff. Thank you, Mr. Chair.
Thank you. May we now hear the comments of DILG, Yusek Echeverry.
Thank you very much, Mr. Chair. Thank you. Thank you, Mr. Chair. This is a prepared position paper done by the legal department. Regarding House Bill number 6096, the department interposes no objection, but actually applaud the efforts of the author. Although we have minor recommendations, it's just minor. Number 1, in section 4, kindly complete the last sentence thereof, which states, it shall also from the registry. What council is being pertained thereto? Also, what is sought to be included or deleted from the registry? Number 2, in section 16, do we use the nomenclature of the revised penal code? in using the terms apprehension, detention, and conditional release, it is suggested that the same be clearly defined. Also, who shall also be responsible for the implementation of this section? Will it be the police officer or health officer or medical practitioners? Kindly clarify this provision, as this may lead to possible and unavoidable confusion to the general public. Number 3, in section 18, paragraph 1, who shall decide if a person is reasonably believed to be infected? What are the parameters to be considered in determining if a person is reasonably believed to be infected? Number 4, it is suggested that the time of detention be specified, as the same might arise to violation of one's constitutional right. Until the patient recovers, until the disease has been contained, or until it be proved through medical investigation that the person is indeed not infected or reasonably believed to be infected. Number 5, in section 24, it is provided that the Health Emergency Coordinating Council shall be created. Is this different from the interagency task force for infectious and emergency disease? Will the IATF be abolished if and when this bill become a law? Number 6, in section 25, what do covered mean? Does this pertain to affected local government units by reason of the disease or infection? Number 8, in section 27, may we seek clarification if the council has the authority to declare a national state of health emergency? And lastly, in section 34, in relation to section 40, what shall the Bureau of Quarantine need to report? Thank you very much, Mr. Chair.
Thank you, Yusek Echeverry. May comment yata si Chair Helen, then Chair Joey.
Thank you, Chair Joet. As to dun sa query ni Yusek Echeverry, I don't know kung naka-attend siya doon sa technical working group meeting natin on the bill ng creation ng National Health Security Act, no? Okay, I don't know who represented the DILG, but it was discussed fully yung delineation kasi doon po sa bill na yon, yung National Health Security Council will be the IATF now, and doon po papasok yung National Action Plan natin. So basically ang function ng council is to the one who will make the yung National Action Plan natin na ginagawa ngayon. So siya yung IATF natin ngayon. So dito po sa CDC hindi nyo po makikita yung structure na yon or yung function na ginagawa nila. May separate bill po kami on that. We'll invite you, Yusek, on our next meeting.
Thank you, Madam Chair.
Yes, I think si Chair Joey would like to comment also. Chair Joey, naka-mute.
I say, mute ba ako? No, I'm not muted. Am I? No. Kaya nga po dito sa bill ko, there was a Health Emergency Coordinating Council precisely to replace or institutionalize IATF. So there will be a smooth transfer. So ano lang talaga dito would be essentially ang focus is pandemic or epidemics, and pangalawa for example kasi ngayon dinidiscuss din ngayon yung DDR, so sino sa dalawa ang magde-declare ng health emergency. So sabi ko dapat yung Health Emergency Coordinating Council or whatever being created in the Philippine Health Security Act. So but basically there is how do you call that, primacy of the experts rather than the DDR or the Department of Disaster Resilience or the NDRMC if it's restored. So mayroon primacy po yung Health Emergency Coordinating Council sa pag-issue ng travel ban, na automatic na pag may state of health emergency, pag pinadeclare ng parang IATF na envision here, na LGUs can automatically use calamity funds to respond to a state of health emergency. So yan yung po, kasi I was looking at the parallelism or the duality of the DDR. I just came from the DDR meeting to the CDC. So just to answer to the inahanap ko pa kung ano yung incomplete sentence ko, but I will text you what it means. Thank you very much, Chairwoman.
Thank you very much, sir.
Thank you, Kong Joey. May we hear comments from the Department of Labor and Employment, Dr. Felix Labanda?
Chair, can I ASEC test ko kweko po ng DOLE?
Yes. Yes, please proceed, ASEC test.
Oo. On this unsigned po yung position, but we will send it once signed by our secretary. The proposed bills on the creation of a Center for Disease Control and Prevention aims to focus, strengthen, and ensure responsive actions and programs of the country in addressing epidemics and emerging or re-emerging communicable diseases. We commend the proponents of the bills for the intention of establishing an agency that will provide science-based services and responses. It bears stressing that the current pandemic has adversely affected our labor force and economy. As such, having a Center for Disease Control and Prevention will approach similar public health issues on a holistic and efficient manner. The working population and the Department of Labor and Employment will no doubt be benefited by policies emanating from a CDCP. It is widely acknowledged that a public health issue may cross into the workplace if epidemics and communicable diseases are not managed properly. May we just recommend that the proposed agency be empowered to coordinate with the other different national agencies which will have a stake on these emerging infectious diseases and may cause disaster and emergencies. Yan po, we do support all the bills on the creation of a CDCP. Thank you, Mr. Chair.
Thank you, ASEC Tess, and noted on your comments. May we get now comments from the DBM? Nandito ba DBM?
Yes. Good afternoon, sir. We the DBM will still submit its position paper, but we laud the intention of the bill, sir. But in order to avoid redundancy, I think the bill should be clear if existing bureaus under the DOH will be fully absorbed by the said or by the proposed authority or department.
Okay.
That's all, sir.
Okay, thank you. Next, any comments from the DTI?
Aye.
Yes, please proceed. Attorney Marimel.
Good afternoon, Mr. Chair. Good afternoon, Your Honors and colleagues from the government. As far as DTI is concerned, Your Honors, given the technical issues on hand, we would like to defer to the wisdom of the Department of Health, which is more competent to comment and provide inputs on the proposed measures. But nevertheless, DTI will submit its position paper, and considering that there are several bills which are in a way correlated, so we need maybe until next week to submit the signed position paper, Mr. Chair. And as far as the proposal to involve our secretary in the national task force to be created, we are inclined to support his inclusion, considering that the Department of Trade and Industry, under the Administrative Code of the Philippines, is the primary coordinative, promotive, and regulatory arm of the executive branches of the government on matters of trade, industry, and investments. So we need until next week, Mr. Chair, to submit our consolidated position paper. Thank you.
Thank you, Attorney. May we now call on the National Security Council. Is Yusek Vicente Agdamag present?
Sir, present. Yes, sir.
Yes, please proceed, Yusek.
Thank you very much, sir, for inviting the National Security Council Secretariat in this very important Committee on Health. In general, sir, we fully support the creation of the Center for Disease Control and Prevention. Since we are in the national security and I come from a military background, I was able to visit the CDC, Center for Disease Control and Prevention of the United States in Atlanta, Georgia. And this one was established in 1946 because of the malaria disease plaguing the country. And of course, what we experienced malaria during World War II in Bataan and Corregidor during World War II. So we need an agency really control and prevention of these diseases. Also during Korean War, really, they really had to establish an office really as a defensive mechanism for all these diseases, especially for the soldiers during this war. But personally, sir, Madam Chairman, honorable members of the Health Committee, and on behalf of my National Security Advisor and the Director General of the National Security Council Secretariat, the Honorable Secretary Hermogenes Peron Jr., this our prepared reply because of the current threat of COVID-19. So on behalf of Secretary Peron, the COVID-19 pandemic has greatly impacted the livelihood, economy, and our way of life. The pandemic not only threatens the economy, health, and safety of the public, but the nation's security as well. And according to some experts, this will not be the last time that the world will be experiencing such magnitude of disease outbreak. Health security demands greater attention today than ever before. It is one of the national security 12-point agenda prioritized by President Rodrigo Roa Duterte in the National Security Policy of 2017 to 2022 as mandated by EO number 16 and our National Security Strategy 2018 with the legal mandate of AO number 12 signed by the President. The Philippines NSP and the NSS stated that national security challenges are intertwined and thus demands a whole of nation efforts in order to address these challenges. The proposed measures on the creation of Center for Disease Control and Prevention and expanding the power of the Department of Health is a welcome development, not only in addressing current health security challenges we are now confronting, but also preparing for future emerging and re-emerging diseases. My last sentence, Mr. Chairman. The National Security Advisor is in full support of the creation of the CDC Philippines, as well as to the expansion of the power of the DOH, and is fully committed to helping the administration in achieving health security for the welfare of the Filipino people and the fulfillment of national security and development. Maraming salamat po, Mr. Chairman.
Thank you, Yusek Vicente. May we now hear the comments of the DOJ? Is Attorney Lourdes? Present.
Good afternoon, Mr. Chair. I'm
Afternoon.
Attorney Robles from DOJ. Okay.
Yes,
The,
please
the
proceed.
department has yet to submit its official position paper. Once it is approved, we will forward the same for the consideration of the committee as soon as possible time. However, as a general observation to the proposed bills, the department interposes no objection to the passage of the subject bills into law. It bears stressing that the proposed measures are in line with the state policy to protect and promote the right to health of the people and instill health consciousness among them. Likewise, it is in consonance with the mandate of the state to adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other services available to the people at affordable cost. Further, as to the membership of the Secretary of Justice to the Council, we interpose no objection in order to have a whole of government approach in addressing public health issues. That's all, Mr. Chair. Thank you.
Thank you. May we now hear from Move as One Coalition, Sir Joshua Mata.
Good morning, Mr. K. In behalf of Joshua Mata, I will read the statement of the Centro of one of the convener of Move as One Coalition. Centro, together with Move as One Coalition, is fully supporting the Congress in establishing of our own Center for Disease and Control and Prevention. We believe that this is long overdue. Clearly, the COVID-19 pandemic has shown how vulnerable we are to pandemic. Our lack of preparedness is a lesson that the country needs to address as soon as possible. After all, with the climate change and the continuous intrusion of development aggression into our pristine environment, the COVID-19 would surely be the first of many pandemics that we would have to face in the near future. Having our own CDC would ensure that the country would be able to upgrade its capacity to fight pandemics and provide science-based responses to it. We are, however, concerned that the absorption and transfer of several bureaus like Disease and Prevention and Control Bureau, Epidemiology Bureau, RITM, and Disease Emergency Management Bureau and Bureau of Quarantine might lead to displacement of some of our public sector workers. In this regard, we would like to propose that the substitute bill include provision that would ensure security of tenure of those affected and those who are unavoidably displaced, if any, should be provided ample safety nets. Thank you, Mr. Chair, for this opportunity.
Salamat po.
We'll submit our position paper soon.
Okay, maraming salamat po. I think Chair Joey would like to comment. Yes, Chair Joey. You are on mute again, Chair Joey.
Si DOJ, pwede pa-unmute din?
Yes, our representative from DOJ.
Yes, sir.
Yung section, kasi may mga bago kong nilagay na kasi I prepared this in, actually I wrote the bill in, in reaction to China. But I filed it on January 29. Meron dyan yung mga section 16, 17, and 18 which may, of course, run yung basically tinatawag nga kaninang apprehension, detention, or conditional release, application of regulation to person entering from foreign countries, pati na po yung parang yung apprehension examination of persons reasonably believed to be infected. So I would just like your clarification. Later on na lang, pag-submit niyo po 16, 17, 18 ng HB 6096. Kasi parang nakikita, as a former governor, I saw that it was very difficult when I applied it to SARS. Hirap na hirap akong palabasin yung tao dahil nga he was suspected na nakasama dun sa eroplano. So the state did not have the power to use it. So I phase 3 already, SARS, MERS-CoV, and AH1N1. So when I was governor. So paano lang po nung section 16, 17, 18 ng HB 6096, pa-comment lang po. Later on na po, pag-submit official submission po ng DOJ.
Yes, sir. We'll try to include that in our position paper.
Thank you very much.
Thank you. Are there any other resource persons or agencies who'd like to comment? So kung wala na po, baka we can get our colleagues, authors, members who'd like to comment. Chair Helen?
Mr. Chair, if wala na pong other members or authors who would like to comment, I would like to move for the creation of technical working group. Is there anyone?
Any second?
Motion, Madam Chair.
Second.
So there's a motion to create.
I'd like to nominate our Vice Chair, Joette Garcia, to chair the technical working group meeting.
So there's a motion duly seconded to create a technical working group for several bills on the CDC. Any objection? Hearing none, motion is approved. And with the creation of the technical working group, may I now turn over the chairmanship to Chair Helen for other matters.
Thank you so much, Mr. Chair, and to our sponsors and colleagues and resource person. I think that's all for today. Definitely all members and resource person, you'll be invited to join in the technical working group meeting. I just want to inform everyone that we've finished the TWG meeting and awaiting for the substitute bill on the creation of National Health Security Council Act. So we decided not to present it to the mother committee yet because we wanted the position of different agencies, especially DOH, because we're concerned more of the delineation of functions. So should we include the creation here because there are bills na nag-create po dito ng National Health Emergency Council. So pareho lang siya ng function. But during the last hearing, Yusek Mayor na suggested that we separate that bill with this one, the creation of CDC. So we have to determine, and as mentioned by Chair Joey, we have the DDR, no? So gusto po natin na well in place yung mga agencies or divisions that we're going to create and malinaw po yung functions nila on different bills. Thank you so much. Can we hear a motion for the adjournment?
Before the motion, Chairwoman, can I just ask for a copy of the PHSA para I could see whether it's better to stand alone or whether it could be absorbed by a more powerful CDC bill.
Thank you, sir. Yes, sir. The Secretariat will send a copy of it.
Thank you very much. I'm not a member of this committee.
Okay, let's
motion to adjourn.
Second. Thank you, Madam Chair.
There's a motion to adjourn. Duly seconded. Section hearing none, the motion is approved. Thank you, Chair Joey. Thank you, Kong Che. Napakaganda
Thank you, Chair.
Thank
you po.
And to all our
Thank you.
resource speakers, thank you for patiently waiting. Thank you so much.
Thank you, Madam Chair.